lost your mind.
Buat bil murah. Tinggal aja ini.
Celebrate tonight.
This webinar series is brought to you by the Philippine Hospital Association.
This webinar series is brought to you by the Philippine
In
Hospital
collaboration with
Association
Alta Renewables Energy Light,
in collaboration with
Holdings
Alta
Corporation.
Renewables Energy Light and Carl Group Holdings Corporation.
Good afternoon and welcome to the Philippine Hospital Association's first webinar.
Good
for
afternoon and welcome to the
2024.
Philippine Hospital
With the overall
Association's
theme,
first
Healthcare
webinar for
Delivery.
2024
Facing the risks
with the
and
overall
embracing
theme,
the rewards.
Healthcare
We are
Delivery,
thrilled to be learning
facing the
all
risks
again
and
and
embracing the
continue to push
rewards.
healthcare
We are thrilled to be learning with you all again as we continue to push the healthcare system for our countrymen.
Participation and viewing. Your microphones are muted by default.
There's some
during the
guidelines
entire
for participation and
If you
viewing.
have questions,
Your microphones are muted by default
type
during
in
the
the
entire
Q&A box.
presentation.
that's
If you have
located at the
questions,
bottom of Zoom's interface.
please type in the
You may use
Q&A
chat
box
to type your
that's
comments,
located at the bottom of Zoom's
and please
interface.
answer the evaluation
You may use
form
the
that
chat
will be
box to
shared
type your
later
comments.
after the lectures.
And please answer the
Also, your
evaluation
attendance is
form that will be
automatically
shared
captured
later
upon
after the
entering this
lectures.
Zoom webinar, so you don't have to
Also,
chat
your
your
attendance is
details.
automatically captured upon entering this Zoom webinar, so you don't have to chat your details.
So let us begin the program by saying a prayer. This will be followed by the Philippine National
So let us begin the
Anthem
program
and the
by saying a
PHA
prayer.
hymn.
This will be followed by the Philippine National Anthem and the PHA
Almighty Father
hymn.
in heaven, we praise your holy name and sovereignty. Thank you,
Almighty
Lord, for
Father
your
in
amazing
heaven,
power and
we
grace
praise your holy
as you
name and
bless each one of
sovereignty.
us gathered
Thank
in
you,
this
Lord,
event
for your
with
amazing
the gift
power
of
and
life.
grace as you
Thank you
bless
for the
each one
strength
of
and
us
hope
gathered
that you
in this
grant
event
us to live our
with the gift of
purpose.
life.
For we know that
Thank
no
you for the
challenge
strength
will
and
break
hope
us
that you
as
grant
long
us
as
to
we
live our
trust your
purpose.
unconditional
For we
love.
know that no challenge
Thank
will
you,
break
Father,
us
for
as
the
long as
incredible
we trust your
sacrifice,
unconditional
for
love.
every body and soul
Thank you,
who
Father,
protects and
for the
guides
incredible
and pours
sacrifice
your divine
and for
will.
every body and soul
Wherever we
who
go,
protects and
help us
guides
desire to
the
become
path
more
towards
like
your
you
divine will.
and live with
Wherever
love,
we go,
joy,
help us
peace,
desire to become more
goodness,
like you
wisdom,
and live with love,
Let us be
joy,
filled with your
peace,
spirit as
goodness,
we rise to meet
wisdom,
each
and
new day with
faithfulness.
hope.
Let us be filled
Father,
with your
we
spirit
ask forgiveness
as we
for
rise
all
to meet
things not
each new
righteous
day
in
with hope.
Christ. We trust your
Father,
guiding light
we ask
to help us
forgiveness
resist
for all things not
temptation
righteous in
and
your
seek
eyes.
your power
We trust your
to
guiding
enlighten
light
us to be
to help
saved.
us resist
All our
temptation
desires
and
and
seek
worries
your power
we lift
to
unto
blanket
you
us to be
through Jesus
saved.
Christ,
All
the
our
Lord.
desires and
Amen.
worries will lift unto you through Jesus Christ the Lord. Amen.
hangaring panlipunan para sa kalusugan. Mahirap o mayaman, handang paglingkuran. Pampubliko't pribado, maglilingkod sa inyo. Kagapay ng bayan, tungo sa kalusugan. Sa pagkakaisa at tapat na pagkalinga, sa bayan ay nagtiwala sa layuning maganda. Sa lungsod o lalawigan, sa bundok o kanayunan, sa ibang sulok ng bansa, laging nakahanda. PHA, PHA, kagapay ng bayan, tungo sa kalusugan. PHA, PHA, kagapay ng bayan, para sa kaunlaran.
To give the opening remarks and acknowledgement, let us all welcome PHA Secretary and Scientific
To give the opening
Committee
remarks and
Chairperson,
acknowledgement,
Dr.
let us all welcome PHA Secretary and Scientific Committee Chairperson, Dr. Digna Ragasa.
Good afternoon and a warm welcome to the Philippine Hospital Association Part 1 virtual webinar. I extend my heartfelt gratitude to all our team members from across the Philippines who have joined us this afternoon. Your presence enriches our discussions and strengthens our collective commitment in advancing healthcare excellence. Ladies, today holds special significance as we celebrate Women's Month. Let us take a moment to acknowledge and applaud the remarkable contribution of women, both within our homes and in the hospital corridors. As healthcare professionals, we dedicate countless hours to serving patients and saving lives. Our shoulders bear the weight of compassion, resilience, and unwavering dedication. So let's give ourselves a well-deserved pat on the back. Together, we shape the future of healthcare, and our impact resonates far beyond the confines of hospital walls. Let this webinar be a platform for shared learning, inspiration, and empowerment. I would like to acknowledge the presence of our PHA officers and board of directors, led by our President, Dr. Jose P. Santiago Jr., our Vice President for Government Hospital Affairs, Dr. Maria Lourdes Raisa, Vice President for Private Hospital Affairs, Dr. Jaime Almora, yours truly as the Corporate Secretary, our Treasurer, Dr. Maria Isabelita Estrella, our PRO, Dr. Elmer Pedregosa, our directors, Dr. Dina Abelia, Dr. Gerardo Aquino, Dr. Conrado Branya, and Attorney Bill Castro, and our immediate past president, Dr. Edmundo P. Lopez, our executive director, Mr. Climaco Caliwara, and likewise to our administrative staff headed by Ma'am Pearl Samonte. We have lined up interesting and informative topics from both our main lecturers and our sponsor speakers. We acknowledge the presence of Dr. Montserrat Chichoco, Medical Center Chief 2 of Jose B. Lingad Memorial General Hospital, our last year's HBP IPC Year 10 overall winner. Dr. Chichoco will talk about institutionalizing infection prevention, and control practices in the hospital, a very important aspect in every hospital. We also thank Miss Abigail Estrada, the Chief Social Insurance Specialist of PhilHealth, for accepting our invitation to talk about guidelines in case rate adjustment, an essential discussion that impacts healthcare providers and patients alike. Thank you to our sponsor partners today, and Philippines Incorporated. As speaker, Mr. John Michael Bernil will present a case study of a hospital that utilizes solar power beyond the environmental benefits discovered by solar panels are a smart choice for healthcare facilities. Thank you to Tokar Group Holdings Corporation. Their website says that they are architects of health innovation. Their speakers will tell us why. Thank you, and let's continue to thrive, learn, and uplift one another. God bless us all.
Thank you very much for
Thank
that
you.
message, Dr. Laganza. And now the
Thank you very
President of
much for that
PHA will have
message,
his
Dr.
time for
Ragazza.
presentation updates. Please welcome Dr. Jose Santiago Jr.
And now the president of PHA will have his time for message and updates. Please welcome Dr. Jose Santiago Jr.
Good afternoon, esteemed members of the Philippine Hospital Association from Luzon, Visayas, and Mindanao. As the Ramadan approaches, Philippine Hospital Association extends its warmest wishes for Muslim brothers and sisters, wishing you a blessed Ramadan. It's my pleasure to welcome you to the launch of the Philippine Hospital Association's four-part virtual webinar series for this year. Many of you are already familiar about this platform. We found this an efficient and effective way of communicating with you of expert insights, innovative product developments, and updates that can help enhance your hospital operations. We have received encouraging feedback from members and concerned government agencies on the content of webinar and the latest guidelines from our partners at the Department of Health Insurance Corporation are shared. Keep joining us in our webinars. We prepare to deliver quality health services to our patients and communities we serve. I'd like to share with you a very important and significant announcement. This year marks a momentous occasion for PHA to celebrate our 75th year Diamond Jubilee. The PHA has been richly blessed to attain a unique privilege of taking 75 years of leadership, empowerment, assistance, and protection for its members' hospitals. We intend to celebrate this milestone with you through a multitude of significant activities during the year. In time, allow me to report to you specific activities that the PHA has been engaged in at the beginning of the year to this day. I began the year with online and in-person meetings with the Office of ASIC, Trade Mercado Grande, Health Regulation, Safety Development, Cluster, PHA is concerned. And the delayed release of LTOs of some member hospitals. Discussion centered in streamlining their licensing process and the implementation of more humanitarian regulation policies with the aim of reducing number of hospitals struggling with their LTO compliances. We believe that we will see some improvements in this regard in the near future. I also attended the policy dialogue that was likewise organized by ASIC Grande, with no less than SOH Ted Bosa in attendance, together with regulation, licensing and enforcement, and Center for Health Development heads. During the said dialogue, regulation and licensing issues in their respective regions were presented, traced out, and resolved. They were advised to implement licensing guidelines with flexibility without compromising patient safety. The technical working group, where PH had been given a seat, was also created to do a SWOT analysis of the process of DOIs, HFSRB, and the PhilHealth and PhilHealth, which objectives to minimize or altogether do away with the delays in the release of LTOs, which consequently resulted in delays in the application for accreditation with PhilHealth or PHC. The PHA wrote the Office of ASIC Grande to inform her of this critical condition or situation, which resulted in the extension of both the LTO and PhilHealth accreditation validities until January 15, 2024 of those facilities that have yet to receive their LTOs. This prevented the gaps in the PhilHealth accreditation, which in effect allowed the continuous filing of claims. PHA also supported the Initiative of PhilHealth to reconcile claims accounts in the respective PhilHealth regional office. PhilHealth early on informed PHA that some of hospitals did not want to submit the details of their receivables. This hindered the reconciliation efforts. The PHA sent out letter to its concerned members, relaying the honest effort of PhilHealth to help trace out what may be needing of clarifications. On this matter, PHA received messages of appreciation from some members. For our member hospitals in Region 4A, it has brought to the attention of PHA that some hospitals' accreditation applications might be denied due to docketed cases dating back into 2018. We have written Pro 4A RBP Dr. Danilo Reyes, emphasizing that according to PhilHealth Circular 2023-0012, only docketed cases within 6 months prior to the application for accreditation should be grounds for denial. Cases older than 6 months should not be resolved in denial, but should be given provisional accreditation. It's very much welcome development. The PHA sits as an external member of the Regional Accreditation Committee, where applications for accreditation facilities and professionals are discussed. This allows your chapter president or council president to bring to the table regarding accreditation issues, delayed claims payments, etc. The PHA as voice of hospitals take on more meaning with this. This was as a result of PHA's continued efforts in making sure that members concerned are heard and resolved. The PHA president, on the other hand, holds a crucial role as a member of the PhilHealth Accreditation Appeals and Review Committee, AARC. This committee deliberates on elevated appeals and motions for reconsideration of healthcare facilities. By participating in these discussions, can further counter and effectively review and appeal denials of accreditation on behalf of our member hospitals. I mentioned earlier that we have many activities lined up for the year in celebration of the 75th Jubilee year, to name a few. We're working on a coffee table book amply titled Brillo. It will chronicle our journey, achievements, and remarkable impact we have made in the healthcare sector. I'm excited to announce that Mr. and Mrs. PHA Search shall be the year-round ambassadors of the organization, embodying a well-rounded perspective of health and wellness and with the public. As ambassadors, they shall promote and advocate preventive care, patient-centered services, and solicit commitment for a multitude of stakeholders towards community health initiatives. We shall pursue the hospital awards, hospital best practice in infection prevention and control awards, now in its 11th year. We're working on holding an interim face-to-face conference this August that will showcase updates on burning issues such as artificial intelligence in healthcare, climate change, impact on health, healthcare technology updates, and dialogues with relevant government agencies and others. PHA has many other plans, but in the interest of time, a better break from now and release announcement on subsequent dates as plans are concretized. Suffice it to say now, for now, that the PSA is buzzing with activities. Expect invitations, announcements, and opportunities to engage. Together we've come a long way. Thank you, our dedicated members, for your continued support and active participation in all of PHA's endeavors. A parting message and prayers for all of us to think as one PHA, for the good of the communities we all
Very much
serve.
for that message and the updates, Dr. Santiago.
Thank you.
Let us now proceed to
Very
the
much
first
for that
talk, which is
message
brought
and
to
the
you
updates,
by
Dr.
Energy Light.
Santiago.
So our speaker is an alumnus of the
Let us now proceed to the first talk, which is brought to you by Energy Light. So our speaker is an alumnus of the Ateneo de Manila University. He worked under San Miguel Corporation, spearheading its battery storage projects across the Philippines. He started Energy Light in Singapore and expanded in the Philippines, and he's one of the leaders in the solar industry in the Philippines. To talk about case study of rooftop solar leasing for San Pedro Hospital in Davao City, please welcome Mr. John Michael Bernil.
So John, please turn on your mic and camera.
There you go. So, yeah.
Sir John, please turn on your mic and camera.
Okay, there you go. So, yeah. All right. So, can everyone hear me? All good? Okay. So, good afternoon, everyone. I'm Michael Bernil, and I'm the president of Energy Light and Alter Renewables. So, today I'll present about the San Pedro Hospital. But to start, I'd like to introduce our company. Okay. So, Energy Light, we're a solar developer, and the solution that we provide our customer is a zero upfront solar for their facility. So, how it works is we provide our solar panel solution without any cost to our partner customers, especially a hospital and like a hospital. And with that, they just have to buy the energy that we produce that is cheaper than what you're paying their utility rate. So let's say for example, here in Manila with Meralco, you pay 11 pesos per kilowatt hour. With our solution, you only have to pay around 6 to 7 pesos per kilowatt hour. So with that, you get a cheaper electricity for your facility, and then at the same time, you get a cleaner energy for your so the company started in 2021, where we have around 20 megawatt of pipeline here in the Philippines. 2022 is when we started our first project here in the Philippines under Polite Marketing and CCS Consulting. 2022 is the time that we also signed our first hospital customer, which is San Pedro Hospital. And 2023 is when we scale our business, where we have our Beto Santa Mall project, and then at the same time, we also signed SM Projects as one of our customers here. So here's our key team. So we have here three parts or three departments in our company, which is technical. First is technical operations, headed by Roel Vergara. Our head of sales, Marco Valeriano, is leading our sales activities, and Jonathan Espiritu is our head of admin operations. So, an example of one of the projects we've done here in the Philippines is the 450 kilowatt peak solar PV solution for a plastic manufacturing company in Mexico, Pampanga. For this particular client, we installed around 830 panels into their facility. This one is owned by our financing partner, Indigo, which is based in Germany. And with that, they're already saving around 700,000 pesos per year, per month rather, for their electricity bill. We also have a mall in Santa Cruz, Laguna, which is Metro Central Mall. So we installed a 1.05 megawatt peak solution into their rooftop. Here we have this is equivalent for around 1,862 panels into their roof. This one is owned by Wayu Energy, it's a Singapore-based investor, and this is the start of our venture into malls here in the Philippines. This 2024 is actually very good for us, as the top mall here in the Philippines trusted our solution and joined into our offering. So right now we are going to start our project with SM General Santos City, which is equivalent to 1.8 megawatt peak system. Aside from that, we're also doing SM Bacolod, which is equivalent. We're installing a system that is equivalent to 1 megawatt peak into their facility, and also SM CDO downtown, which is going to have a 1 megawatt peak system as well. So with all these customers that we're trying to service, we are providing them a top-notch solution, and then at the same time helping them save their electricity bill. To highlight one of the customers that is close to our association right now is one of them is San Pedro Hospital. We're very grateful that they allowed us to present their case study so that everyone can see the value that solar PV solution gives them and what Energy Light and Alter Renewables has provided them last year. So for this one, this project is actually is around 480 kilowatt peak system. So there's 760 panels that we installed into their facility. This project is owned by Ecoligo, and for this particular client, it's actually a bit complicated because there's actually 3 sections into their wing, and then 2 other buildings that is also has different elevation. So on our side, it's as you can see in the picture, there's actually several areas where it's a bit difficult to install solar panels, but we managed to pull it off. And then at the same time, we also help them retrofit their roof before we actually started our installation. So meaning on our side, we renovated their roof structure first before we actually place our solar panels, so that we can ensure that throughout the duration of our contract, will their system or their hospital is actually safe from any possible damage that may happen because of the additional load that we place to their roof. So for our project, we actually offer them 7 pesos per kilowatt hour. This includes the retrofitting that we did under their facility, and then at the same time, we also are going to give them the rooftop solar after our 20-year contract with each other. So meaning, throughout the next 10 to 15 years where the system is in operational, you're going to get free electricity for their hospital savings that they have now, coming from the utility rate, which is around 11.33 pesos per kilowatt hour that they're paying to the power lines as of January last year. So the estimated savings that we're providing to them is around 2.5 million pesos per year, which is a big savings for their operation. Aside from that, we're also giving them a zero maintenance cost. So meaning, aside from the free electricity that they're getting, you actually don't have to worry about the operations of the solar PV system. On our side, we're actually visiting their facility on a quarterly basis to do cleaning and at the same time to check the system if there's any problem with the installation that we did. And we're going to do that throughout the duration of our contract, which is actually a big relief onto their technical team that is not, of course, knowledgeable onto the solar PV system that we're installing into their roof. Our solar PV system is also very stable. It has 100% power factor. So meaning, with our solution, you don't have to worry that any of your machine may have any trouble with the power that the solar PV system will provide for your facility. So this is a big plus, especially for areas that are having some issues with their voltages. I think some hospitals or most of the customers that we have in the provinces are experiencing this. And then at the same time, aside from the monetary or economic benefit that we provide, we're also helping them reduce their carbon emissions. So with our solution, we're actually reducing it by around 400 metric tons carbon dioxide reduced every year. And this is equivalent to around 400 trees planted every year with them using our solar PV solution. And what's important for us is actually the safety in terms of the implementation and maintenance of our system. With our solution, we're actually placing walkways into your roof. And as you've seen in the picture with San Pedro Hospital, we ensured that there's actually areas where workers that will install and maintain the system can walk through so that we can ensure their safety. We also place some guardrails for some of our solutions and anchor points wherein this is something that allows them to have a point of connection in case of they're working on top of the roof. And then at the same time, if in areas or clients that don't have cat ladders, we also provide them free cat ladders so that there's going to be a permanent access to their roof while they have our solution. And then with our solution, we also implement factory level testing. So all critical components like solar panels, inverters, mountings, sensors, they're all tested before they are shipped out from the factory so that we can make sure that the system is actually perfect for the electrical system that you have for your facility. Aside from that, we do easy reading for the installers that we use so that we can ensure that whoever works for your facility is actually competent and has a long-standing history of doing this kind of installation. And lastly, we do site acceptance tests. So once the system arrives on site, we actually test it so that before installing it, so that we can make sure that the system is actually that is given to us is actually as per our design. So let's say, for example, for a mounting solution, it can withstand around 300 kilometers per hour. So it can withstand the strongest typhoon that hit the Philippines. So in this case, whenever there's typhoons that hit your hospital, we can ensure that the solar panels on top of your roof will not be damaged when these things happen. And then we also handle and as I mentioned earlier, we also handle the operations and maintenance of our system. So with that, we provide corrective maintenance. Wherein we have local team that provides the same time trainings and then at the same time repairs your system if there's any problem. And then at the same time we also offer performance guarantee wherein with the solution that we provide, we are actually reducing or we are actually guaranteeing your savings for your facility. And then we also do some preventive maintenance wherein we visit your facility on a quarterly basis. San Pedro Hospital, we are visiting it on a quarterly basis so that we can actually ensure that the system is performing optimally, and then at the same time, there's going to be no problem on its operation that may affect the operation of the hospital. All right, so that's it. If you have any questions about our solution and our offering, feel free to join our group or later during our Q&A. Thank you so much.
Mr. Bernil and Energy Light.
All right, thank you very much for that presentation, Mr. Bernil and Energy Light. If you have questions, as mentioned earlier, you may type in the Q&A box and Mr. Bernil can reply to you, or he can also join the open forum later. Now let's go to the first main topic for today. Our speaker is the Medical Center Chief 2 at Jose B. Lingad Memorial General Hospital. She was the overall winner of HBPIPC Year 10 Awards She's a diplomate and fellow of the Anatomic and Clinical Pathology. She had her master's degree in business administration, specializing in hospital management, a certified public administrator, and a fellow of the Philippine College of Hospital Administrators Incorporated, part of the Board of Trustees of the Philippine Council for Quality Assurance. To talk about institutionalizing infection prevention and control practices in the hospital, please welcome Dr. Montserrat Chichioco.
Good day, everyone. This is Dr. Montserrat Tebilingan Memorial General Hospital. Good day, everyone. This is Dr. Montserrat Tebilingan Memorial General Hospital. Today, I will be discussing about infection prevention and control and how we institutionalize it in our hospital. Infection prevention and control is a practical, evidence-based approach, averting patients and healthcare workers from being harmed by preventable infections. It is an integral element of patient safety and quality of care. It is collectively relevant to every healthcare worker and patients in every healthcare interaction. Our hospital believes that infection prevention and control is everyone's business, and empowering the healthcare workers, the patients, and their watchers is a great help in achieving our goal to prevent infection transmission in the hospital, ensuring that the patient environment is a safe place for their healing. Our mission is to protect and promote the health and well-being of patients and healthcare workers by preventing the spread of infection through an effective and efficient surveillance mechanism, evidence-based comprehensive infection prevention and control measures, and continuous capacity building activities. Assigning the right people to do the job is a key to the success of the program. We create an IPCC team composed of members from the different disciplines, the medical, non-medical, nursing, and other hospital support staff. We do capacitation of healthcare workers by sending them to certification courses, one of which is the Basic Competency Training course for Infection Prevention and Control nurses, and we have the nurse certification programs and trainings for basic epidemiology and surveillance, which is conducted for the doctors and the nurses. To date, we have 13 certified IPCNs assigned in the wards as nurse links, and 4 more are undergoing training. Engaging infectious disease experts ensure guidance in the proper management of patients and to recommend appropriate measures to resolve issues or improve the outcome of an intervention. Engaging experts also ensures that all policies are updated and based on international standards. JBL-MGH delegated 3 disease surveillance officers to monitor notifiable diseases under the Philippine Integrated Disease Surveillance and Response. To maintain the infection prevention and control programs, the management created 3-year sustainability plan by the inclusion of the IPCC plans, activities and programs to the hospital annual strategic planning and project procurement management planning. Hence, a yearly approved professionals and even hospital support staff is a committed deliverable in our performance governance system. Professionals and even hospital support staff is a committed deliverable in our performance governance system. The IPCC is forthwith processing the CPD unit's application of all IPC-related training programs, offering other institutions to be part of our continuing education. Approved CPD units from some of our trainees have been recognized. We conduct a yearly SWOT analysis to identify factors that impact our infection prevention and control program implementation. This method helps us strategize and prioritize programs to improve our IPC practices to further decrease healthcare-associated infections. The results of the SWOT analysis is utilized to help us revisit our existing policies, organize capacity building activities, and create or innovate strategies and programs to ensure that we continuously achieve our goal of maintaining less than 1% healthcare-associated infections. For the sustainability of our infection prevention and control programs, we follow the 5 multimodal approach. The use of multiple approaches that in combination will influence the behavior of healthcare workers towards the necessary improvements that will greatly impact on patient health outcomes and contribute to organizational culture change. The first approach focused not only on infrastructure or equipment, but on systems. To improve the compliance of the healthcare workers regarding infection prevention and control, the committee created manuals of operations, policies and procedures in every ward and special areas, work instructions and memorandums based on WHO, CDC, and DOH updates and specialty societies guidelines. This part of the Build It mode to standardize all processes and procedures constitute our system change. The manuals of operations, policies, and procedures are digitalized and can be accessed by our personnel through our personal information system, even in their homes.
Own isolation building with negative pressure rooms and emergency rooms.
For the infrastructure, JBL has its own isolation building with negative pressure rooms and emergency rooms to be used for emerging and re-emerging infections, and isolation rooms per floor for the healthcare-associated infections. Majority of the patients' rooms are installed with negative pressure. Part of the surge management plan is the ongoing construction of the new 3-story infectious disease isolation building. Annual budget is allotted for the procurement of high-level disinfectants for surfaces and equipment, housekeeping supplies, and machines such as automated instrument washers, autoclaves, UV lights, industrial air purifiers with UV light and high spray machines. The management also makes certain that there are sufficient resources devoted to the housekeeping unit to consistently ensure effective cleaning, disinfection, and sterilization, even during surge capacity for high-demand periods such as outbreaks and inflated occupancy. The Infection Prevention and Control Committee facilitates mandatory orientation on IPC practices, students and interns that includes hand hygiene, cleaning, disinfection and sterilization, healthcare waste management, SHARP's safety, standard precautions, prevention of healthcare-associated infection, antimicrobial stewardship, and pointing out the occupational risk to all personnel. After the lifting of the state of public health emergency, the Infection Prevention and Control Caravan resumed its activities, wherein the IPC nurses integrate in the meetings of each unit and rove in the offices, clinics and wards to do short health teachings and present videos of proper hand hygiene, waste management, cleaning, disinfection and sterilization, and respiratory etiquette, and COVID-19 updates and updates on some emerging and re-emerging infectious diseases. Our healthcare personnel, students and interns, the IPCC conducts weekly seminars on different topics on infection prevention and control. Part of the training program is skills enhancement through return demonstrations in proper hand hygiene, donning and doffing, proper suctioning, wound care, vascular catheter care, specimen collection and transport, and proper sharps handling. The IPC nurses are roving every day to evaluate the hand hygiene compliance of staff using the compliance monitoring checklist through direct observation, which is considered as the gold standard in evaluating hand hygiene compliance. The hands observers in the facility are trained in utilizing the WHO My 5 Moments for Hand Hygiene methodology. Each unit in the hospital designate a hand hygiene officer with the main role of teaching and monitoring the hand hygiene compliance of the nursing staff, patients, and relatives. Newly hired personnel are encouraged to have a buddy system. This is a program in which the healthcare worker is teamed up to an established, trained employee who takes responsibility in introducing them to the hand hygiene culture of the hospital, including practical training on indications and techniques in performing hand hygiene and explanation of hand hygiene promotion initiatives within the hospital. The infection prevention control nurses conducts daily rounds overseeing the cleanliness of each unit using the IPC compliance monitoring checklist that also involves the inspection of soaking solution stability. Appropriate and well-maintained materials for cleaning are made available and monitored by the wash team and housekeeping supervisors. A mechanism to track supplies of IPC-related materials in coordination with the central supply room is established. Records of cleaning is observed and signed by the cleaners and supervisors each day. Feedback of data related to IPC compliance, which includes cleaning, disinfection, and sterilization, and other indicators with demonstration of trends over time, is given to the management monthly. The IPCC formulated the IPC compliance monitoring checklist to gauge the compliance rate of the hospital to attain at least 85% of the target. The checklist consists of different compliance parameters on hand hygiene, standard precaution, instrument disinfection and sterilization, equipment care, sharps handling and disposal, preparation and administration of medications, isolation precaution and patient transport, utilization of bundles of care, IV site, IV tubing, Soluset monitoring, patient environment, linen handling and monitoring, and healthcare waste management. The compliance rate of each unit is tabulated to get the hospital compliance rate and reported to the medical center chief, then disseminated to all division heads monthly, and will serve as the basis of the JBL-MGH IPC compliance rate and awarding of best units in IPC practices. In the ICU, a team leader or a designated hand hygiene officer in the shift roves around the unit with a placard stating a reminder to perform hand hygiene. Each unit has an assigned hand hygiene officer who serves as an advocate for patient safety, promoting hand hygiene standards, and takes responsibility on publicizing a project or constant reminder to employees to perform hand hygiene in their unit. Daily prompting reminders to perform hand hygiene, practice cleaning and disinfection, wearing of masks and proper waste segregation, and 5 hours of waste reduction in JBL-MGH Output Messenger that sends message to all the computer units in the hospital is part of our Sell It mode. Visible posters of 6S reminder are strategically posted in each unit of the hospital, including elevator doors, so that even those who step into the elevator is reminded. We also created and posted the steps on how to properly clean and disinfect all the equipments in the ward. All the installed sprayer on the non-critical item has reminder stating that disinfection saves lives. Reminder regarding 5 hours of waste reduction and importance of hand washing is also posted in elevators.
The top management sets a role model to lead the hand hygiene.
As we say, we should live what we talk. The top management set as a role model as they lead the hand hygiene demonstration during our flag ceremony. They also support the 20 Seconds project of the IPCC. This project aims to ensure that the healthcare workers can perform hand hygiene after each patient contact. The IPCC provided handheld alcohol sprayers to personnel, students and interns, and outsourced personnel who do not have alcohol dispensers during their tour of duty, with a reminder stated in the alcohol sprayer that 20 seconds save lives. Disinfect your hands. Some personnel are willing to be IPC champions by implementing some innovations in their unit. This is one of the innovations of a personnel during a time when there is an increasing case of influenza-like illnesses. The unit created a respiratory etiquette station.
To encourage engagement of healthcare workers
Among our
in
best
promoting
practices
hand hygiene, yearly contests are
is
being
on
launched
advocacy.
every month. Hand
To
Hygiene
encourage
Day,
engagement
which
of healthcare
include
workers
jingle
in
or
promoting
video
hand
making
hygiene, yearly
During
contests are
World
being
Hand
launched
Hygiene Day
every
last
World
May
Hand
2023,
Hygiene
we
Day,
conducted the
which
Hand
include
Hygiene
jingle or
Jingle
video
and
making
contest.
contests. During the World Hand Hygiene Day last May 2023, we conducted the Hand Hygiene Jingle and Video Making Contest. This is not only fun, but educational as well, and the employees participate as well.
Tawagin niyo ang lahat, JBL ang haharap. Doktor at nurse magkaisa, lahat tayo'y magtulungan. Tayo na tumpisahan, matutong maghugas ng kamay. Para sa kalusugan, lahat tayo'y magsimula. Di mo kailangan pag-isipan ng husto. Maghugas, sumangti, kumalat ang mikrobyo. Ang mga hugasera, kumuha ng sabona. Pagdikitin ang mga balat sa kamay. Ang mga hugasera, ipahid ng sabata. Siguradong kaligtasan sa lahat. Ang mga hugasera, ang mga hugasera.
Yearly, we also conduct digital poster making contests with cash prizes, and the winner art will be posted in strategic areas in the hospital. During the National Infection Prevention and Control Week, we conduct IPC Battle of the Brains. The questions consist of trivia and current events regarding infection prevention and control. Employees participate and enjoyed as well the educational and fun activity. We recognize employees in the housekeeping units as we consider them as our partner in infection prevention and control. This is one of our strategies to ensure compliance to policies and programs, the rewards and recognition mechanism.
For medical and non-medical divisions,
We also recognize the best units in infection prevention and control practices. For medical and non-medical divisions, and individuals are awarded as IPC champions.
with awarding of cash prizes.
We
and
conduct year-end
certificates to the
recognition
IPC
of
champions
overall
of
best
the
units
year.
in IPC practices, with awarding of cash prizes and certificates to the IPC champions of the year.
Programs include
The success indicators for the effective implementation of our infection prevention and control programs include the healthcare associated infection rate.
annual rate of
This table shows that our HAI rate for the year 2023 is decreasing with an annual rate of
which is more than
10% as compared to the year 2022 of 0.77%, which is more than 200% accomplishment rate in our OPCR core function number 4, which is healthcare associated infection rate of less than 1%.
infection prevention and control compliance.
Another indicator is the hand hygiene compliance rate, and the other one is infection prevention and control compliance rate. The tables show an increasing trend among our healthcare workers, which is a big factor in decreasing our healthcare associated infection rate. The higher the compliance, the lower the healthcare associated infections. From our effective IPC programs, we saw the gains that improve our hospital operations in terms of the improvement in the quality of care with less morbidity from healthcare-associated infections. There is an improvement in the safety of our employees with a marked reduction of needle stick injuries from improper sharps disposal, mitigated by the proper training and monitoring to compliance of our policies. There is also an improvement in the random environmental culture results, resulting to less expenditure on the use of high-level disinfectants. And there is a reduction in the generation of infectious waste from the rational use of PPE and proper waste segregation. With this presentation, we wish to impart some of our best practices that we willingly share to our colleagues in the healthcare community. Thank you very much and good day to everyone.
We will see you later during the forum. Once again,
Okay, thank you for that, Dr. Chichoko. We will see you later during the open forum. Once again, if you have questions about any of the topics, please type in the Q&A box. Up next, we will receive updates on the guidelines in case rate adjustment to be presented by the Chief Social Insurance Specialist, Benefits Development and Research Department of the Philippine Health Insurance Corporation. Please welcome Ms. Abigail Estrada.
Good afternoon, everyone. Good afternoon to all the members of the Philippine Hospital Association. And we thank you for inviting
Good afternoon, everyone.
during this
Good afternoon to all the members of the Philippine Hospital Association. And we thank you for inviting again PhilHealth during this important event of Philippine Hospital Association. Allow me to share my screen.
Can you see my slide now?
Yes, ma'am. Please continue.
Can you see my slide now?
So,
Yes, ma'am.
in
Please
this
continue.
juncture, allow me to present to you the rules
Okay. So
adjusting case rates. So, by
in this
virtue of the
juncture,
circular
allow me
number
to present to you
2024
the rules for
0701,
adjusting
we have
case rates.
implemented
So
the
by
adjustment of
virtue
case
of
rates
PhilHealth
for
Circular number
inpatient
2024-0001, we have implemented the adjustment of case rates for inpatient services.
My apologies, but I'm having a hard time with this slide for a while.
My apologies, but I'm having a hard time with
So the
this
outline of my
slide for a
presentation
while.
includes the objectives and legal mandate of this policy and the
Okay,
provisions
so
stated
the outline of
therein
my
were
presentation
includes
includes the
the
objectives and legal
statements
mandate
and the
of this
effectivity
policy,
of the
and the
particular
provisions stated therein
policy
were
on
includes
case
the
rates
policy
adjustment.
statements and the date of effectivity of the particular
So the
policy
objectives and
on
legal
case
mandate
rates
of these
adjustments.
initiatives of PhilHealth is into rationalizing the increase
So the
of case
objectives and
based
legal mandate
payments,
of these
expand protection
initiatives of
against payment
PhilHealth is
to
into
maximize premium
rationalizing the increase
contributions
of
by
case-based
expanding benefit
payments,
payouts
to
for all
expand protection against
Filipinos.
financial,
The
to
legal
maximize premium
basis of
contributions
these
by expanding
initiatives
benefit payouts for all
includes Section 10
Filipinos.
of
The
RA
legal
7875 as
basis
amended
of
by
these
RA
initiatives
9241 and RA
includes
1006,
Section 10 of
wherein
RA
at the level of
7875 as
providing
amended
benefit
by RA
packages, members and their
9241 and RA
dependents are entitled
1006,
to
wherein
additional services
at the level of
subject to the
providing benefit
limitations as
packages,
determined
members
by
and their
PhilHealth
dependents
with
are
the end
entitled
review of
to at
quality
least minimum
assurance, increased
services
benefits, and reduced
subject to the limitations
out-of-pocket
as determined by
expenditures.
PhilHealth
Likewise,
with the end
it
in
was
view of
also
quality assurance, increased benefits, and reduced out-of-pocket expenditures. Likewise, it was also stipulated under the Section 34 in the section of provider payment mechanisms that the following mechanisms for public and private providers shall be allowed in the implementation of the National Health Insurance Program, and that includes the case-based payment. Also, under the Section 27 of the said law, whenever actual reserves exceed the reason calling, the corporation's reserve fund shall be used to increase the program benefits. Also, with this implementation, based or as provided for by PhilHealth Board Resolution numbers 2802, a series of 2024, wherein PhilHealth adjusted and rationalized select case rates using a robust costing methodology, and with the PhilHealth Board Resolution number 2871, series 2024, the board approved an inflation adjustment factor of 30% for existing case rates. Likewise, this policy covers the adjustment of case rates to improve financial protection coverage for quality health delivery and should be implemented by all accredited health facilities, including those who are involved in implementing the adjustments of case rates. The policy includes lots of policy statements that as to be considered by those who are implementing the all case rates, particularly the accredited health facilities. So in this adjustment of case rates, we use the provider payment mechanisms we call the case-based mechanism to reimburse accredited health facilities for the minimum standards in delivering inpatient services in a basic or ward accommodation, wherein there is a predetermined fixed payment for a specific case or episode of care, and the case rates shall be set in consideration of the average cost of a case or an episode of care, the different sources of funds used in paying for the case, the available fiscal space of the corporation, and any applicable laws and rules governing the use of the PhilHealth Benefit Fund in paying for health care services. The full coverage of the cost of care are covered, and it should be in the minimum standards in basic or ward accommodation. Also, in this implementation of the adjustment in case rates, tiered approach was done to adjust the case rates, whereas a set of prioritized case rates shall be rationalized based on micro-costing, and the remaining case rate shall be adjusted using an inflation adjustment factor. As you can see, we have just implemented the rationalized case rates last year for acute stroke, ischemic and hemorrhagic, as well as the pneumonia high risk. PhilHealth uses criteria to rationalize the prioritized case rates, which include but are not limited to burden of disease, the volume of claims, and the contribution to catastrophic expenditures. Also, the remaining case rates shall be subject to a secondary review for inflation adjustment, taking into consideration the frequency of updating, insurance risk, the appropriateness of current rates, and the anticipated market effects. Hence, a set of criteria was used to prioritize, which includes but is not limited to the following. So among the inclusion criteria that was used by PhilHealth includes the volume of claims and the contribution to catastrophic expense. Likewise, there are identified exclusion criteria when PhilHealth implemented the adjustments in case rates. So for other conditions or other procedures, there are benefit packages that have been adjusted in the past 5 years. So when we say adjusted, these cases are being recosted and are scheduled for adjustment within the applicable year or in the past year. So that includes the hemodialysis. Also excluded in the adjustment are the benefit packages that are being recosted and are scheduled for adjustment within the applicable year. So currently, we are adjusting or recosting the C benefits packages. Also excluded in this adjustment in case rates are the benefits packages that have been developed in the past 5 years, as well as the cases that are identified to have a high risk for moral hazard and or adverse incentives, no? And the benefit packages that are paid through other provider payment mechanisms such as Consulta.
Adjusting the case rates as necessary using the estimates
So
from
PhilHealth shall
bottom-up
retain
or
flexibility in
That's
adjusting the
why for
case
the
rates
past
as
year,
necessary
we involved
using the estimates from
selected
bottom-up or
accredited
micro
health
costing. That's
facilities
why
in
for the
our
past
costing
year,
activity
we
or costing
involved
survey
selected
so that we can get the
accredited health facilities
actual
in
cost of
our
care in
costing
the
activity or
facility
costing
itself.
survey
And we apply an
so
inflation
that we can
adjustment
get the
factor and or any
actual cost of care in
other
the
robust
facility
methodology or
itself.
approach
And we
update
apply an inflation
key
adjustment
standards of
factor
care to
and or
promote the
any
efficient delivery of services
other
by
robust
healthcare
methodology or
providers as
approach and
applied in the
update
local
in
context.
standards of
So
care to promote
with
the
this
efficient
adjustment,
delivery of
PhilHealth
services by
has
healthcare
a schedule
providers
of
as applied
rates
in
for
the
public
local
access
context.
that you can be
So
accessed through
with
the
this
PhilHealth
adjustment,
website.
PhilHealth
And it can be
has a
other
schedule of
appropriate
rates
official
for
channels
public
for the proper
access that you
information and
can be
strict compliance
accessed
of
through the
accredited
PhilHealth
healthcare
website,
providers
and it can
as well
be in
as
other
our
appropriate
regional
official channels for the proper
so the
information and
schedule
strict
of
compliance of
rates shall
accredited
serve
healthcare providers
rates
as well as
per
our
case and shall
regional
serve as the
offices.
basis for payment
So
for
the
the
schedule
individual
of
case
rates shall
managed by the
serve as a
accredited and or
rates
contracted
per
provider,
case and shall serve
irrespective
as the
of the
basis for payment for the individual
actual
case
individual
managed by the
charges for
accredited and
admission
or contracted
or
provider,
benefit
irrespective
utilization
of
as
the individual
captured in the statement.
charges, actual individual charges per admission, or
So the
benefit
inflation adjustment
utilization as
factor
captured in the
that was
statement of account.
applied is set at 30%. So the
So the
adjustments
inflation
shall apply
adjustment
to
factor
case rate
that
claims of
was
accredited
applied
public and
is set at
private health
30%.
facilities.
So the
With
adjustments
first
shall
and
apply
second case
to
rates in
case rate
accordance
claims
with
of
the
accredited public and
existing
private
rules
health
on all
facilities,
case rate
first
implementation.
and
And
second
the
case rates in
adjustment
accordance
likewise
with the
applied to the
existing
benefits
rules
packages
on all
under
case rates
sustainable development
implementation.
goals
And the
that are
adjustment
paid as case
likewise
rates such
applied to the
as
benefits
PBDOTS, the
packages
outpatient
under
HIV/AIDS
sustainable
treatment
development goals
package, the
that
Annabelle
are
Valley,
paid
as
as
well as
case
the
rates
newborn
such
package
as
and maternity
TB-DOTS,
package.
the
So
outpatient HIV/AIDS
also
treatment package, the
in
Annabelle
relation
Bite,
to
as
the
well as the
sustainable
newborn
development
package and
goals,
maternity
with this
package.
policy
So
of adjustment in
also,
case rates, we
in
are
relation
also
to the
applying
sustainable development
payment
goals,
for
with this
postpartum
policy
progestin
of
subdermal
adjustment in
implants,
case
which will
rates,
therefore
we
be
are
paid
also
as second case
applying
rate.
the
So
payment
that's one
for
of the
postpartum progestin
additional
subdermal
updates in the
implants,
current
which will
policy.
therefore be paid as second case rate.
So
So
all PhilHealth
that's one of the
beneficiaries
additional
shall be
updates in the
entitled
current
to
case
no
rates.
copay if they are
So
admitted
all
in
PhilHealth
basic or ward accommodation
beneficiaries shall be entitled
in
to
public
no
and
co-payment
private
if
health
they are
facilities.
admitted in
Also,
basic
the
or ward
PhilHealth beneficiaries
accommodation
seeking care in non-basic
in
accommodations
public
in public
and
health
private health
facilities may be
facilities.
charged
Also, the
maximum
PhilHealth
out-of-pocket
beneficiaries
payment
seeking
to not
care in
exceed the
non-basic
volume of the
accommodations in public
case
health
rates.
facilities
Included
may be charged a
herein
maximum
are
out-of-pocket
the
payment to
provision
not
that
exceed the
accredited
value of the
public and
case
private
rates.
health
Included
facilities shall not
herein
balance bill
are
patients admitted
the
in
provision that
basic
accredited
or ward
public and private health facilities shall not balance bill patients admitted in basic or ward.
accredited public and private health facilities shall
Also in this
participate in the
statement,
shadow
we
billing for
on this policy,
PRPs
we emphasize
following
the
PhilHealth
accredited
Circular
public and private health
2023-040
facilities shall participate in the shadow
and
billing
its
for the
succeeding revisions
PRGs
as we are
following
moving
PhilHealth
towards
Circular
fully implementing the
2023-014
diagnosis-related group-based
and
provider
its
payment
succeeding revisions
mechanism.
as we are moving
And
towards
also, the
fully
cost in excess of
implementing the
payments made through
diagnosis-related
case rates shall be
group-based
subject to
provider payment mechanism.
cross-subsidization using either
And
other
also, the
fund
cost in
sources
excess
or
of
efficiency
payments made
gains
through
may be
case rates shall
applicable
be subject
or
to
out-of-pocket
cross-subsidization
spending in
using
accordance
either
with the
other fund
PhilHealth
sources or efficiency gains as may be
so
applicable
any
or
profit
out-of-pocket
accrued or
spending
surplus
in
by any
accordance
accredited
with
health
the PhilHealth
facilities from
rules
PhilHealth
and
reimbursement
guidelines.
shall be
So
used for
any
continuous
profit
quality
accrued
improvement,
or surplus by any
secured as
accredited
part
health
of their
facilities from
performance
PhilHealth
commitment
reimbursement
and
shall
or
be
for
used for
implementation
continuous
of
quality
balance
improvement,
sheet.
CQI as
So with
part of
this
their
adjustment in
performance
case rate,
commitment and or
there
for
are
implementation
no
of no
other new
balance fee.
rules. However,
So
we
with this
emphasize that
adjustment
the
in case
accredited
rate,
health facility
there
shall
are
strictly
no
follow current
other new
PhilHealth policies
rules.
and claim
However,
submissions,
we emphasize
including
that the accredited health
correct
facilities shall
ICD-10
strictly
coding
follow
of
current
private
PhilHealth policies and claim
procedure
submissions,
coding, and the
including
submission of properly
correct
accomplished PhilHealth claim
ICD-10
forms,
coding
statement of
of the
accounts, and
primary
other data
diagnosis
and
and or
documentary
procedure coding,
requirements
and
as
the submission
stipulated.
of properly accomplished PhilHealth claim forms, statement of
Also,
accounts,
since
and other
PhilHealth
data
already
and
implemented
documentary
the submission
requirements
of
as
electronic
stipulated in
SOA
existing
by virtue
policies.
of PhilHealth Circular number
Also, since PhilHealth already
2023-006,
implemented the submission of
we
electronic SOA
emphasize that
by
all
virtue of
accredited health
PhilHealth
facilities
Circular
shall
number
provide data on professional and
2023-0026,
breeders' fees
we
in the electronic
emphasize that
statement
all
of account
accredited
and
health
itemized
facilities shall
charges
provide
for
data
all
on professional and
services
readers'
provided
fees
to
in
our
the electronic statement of account and itemized
also, in
charges
this
for all
policy, we would like to
services
reiterate
provided
that
to
all
our
accredited
members.
health facilities shall follow all relevant
Also, in
laws,
this
such
policy,
as
we would
RA
like to
number
reiterate that all
19994
accredited
and
health
RA
facilities shall
number
follow all relevant
10754,
laws, such
and the
as
order
RA
charging
number
based on Joint
19994
Administrative
and
Order
RA
number
number
2020-001,
10754, or
wherein this
and the
is
order
the
charging based
Malasakit
on Joint Administrative Order number
policy by Malasakit law,
2020-001,
and
wherein
PhilHealth
this is
benefits
the
and all
Malasakit
mandatory discounts provided by law, such as
policy
but not
by
limited to
Malasakit
senior
law,
citizen and
and
PWD
PhilHealth
discounts
benefits
shall be
and all
deducted
mandatory
first
discounts
from
provided
the
by
total
law,
hospital fee
such
of the
as but not
patient,
limited to
and the
senior
benefits
citizen and
from
PWD
private health
discounts, shall be deducted
insurance,
first
HMOs,
from the
or
total
employee
hospital
benefits
bill
shall
of the
complement
patient,
the
and the
PhilHealth
benefits
benefits
from private
packages.
health insurance,
So
HMOs,
PhilHealth
or
shall
employee benefits
reimburse
shall
its
complement
accredited
the
health
PhilHealth
facilities
benefits
based on
packages.
the published case
So
rates.
PhilHealth
It
shall
is still the same
reimburse
as we
its
really
accredited health
the
facilities
facility
based on the
submit
published
the claims on
case
behalf
rates.
of
No, it
PhilHealth
is still the
members
same,
or
and we
the
really
patients.
encourage
And the
the
claims shall
facility
be
to
subjected to
submit the
a
claims on
post-payment
behalf of
audit
the
following
PhilHealth
existing
members or the
monitoring.
patients, and the claims shall
So
be
I think
subjected to
this
a
is my last
post-payment
slide,
audit
and we want
following
to
existing
inform
monitoring
everyone and
rules.
Filipinos that
So I think
PhilHealth is
this is my
implementing
last
the
slide, and we
pinalawak at
want
mga
to
bagong benepisyo para
inform
sa
everyone and
mabibilang
all
Pilipino.
Filipinos that
With
PhilHealth
that, thank you
is
for your
implementing
kind
the pinalawak at mga bagong benepisyo para sa mamamayang Pilipino. With that, thank you for your kind attention.
Information. Mrs. Estrada. Now again, if you have questions,
Thank you very much
please
for
type
sharing
in
those
the Q&A
information,
box for easier facilitation during
Ms.
the open
Estrada.
forum.
Now again, if you have questions, please type in the Q&A box for easier facilitation during the open forum. Now before that, we have another presentation, this time brought by another collaborator for this webinar. Let me introduce all three of the presenters. The first is a graduate of Bachelor of Science in Medical Technology from FEU NRMF. She's also graduate of Bachelor of Nursing in DLSC and graduate of College of Medicine of the Chinese General Hospital College of Medicine. She passed the Life License Qualification Program, Toronto, Canada, for Mutual Fund Dealers Association of Canada. That is Dr. Mary D. Happy Texon Iturralde.
Is university professor of
Also part of the
Information
presentation,
Systems
sorry,
and
let me just
Information
introduce all.
and had Masters of Hospital
Is University Professor of
Administration, also
Information
certified public
Systems and
accountant,
Information
certified
Technology,
management accountant
and had
in the US,
Masters of
and
Hospital
graduate of
Administration,
Bachelor of
also
Secondary
a certified
Education.
public accountant
That's
and
Mr.
certified
Glenn
management
Lorente.
accountant in the
And
US,
rounding up
and a
this,
graduate of Bachelor
this
of
group is
Secondary
registered medical
Education.
technologist
That's
Carl
Mr.
Luisa
Glenn Lorente.
Rodriguez.
And
So
rounding up this group is registered medical technologist Carl Luisa Rodriguez. So
Representing Anacral Holdings Corporation, and I'm speaking as a Director of Medical Affairs.
Recording in
And the Call
progress.
Group Holdings Corporation, and I'm speaking as a Director of Medical Affairs. Of this PHA's four-part virtual webinar.
So guys,
make
we
things
are
move
again
forward,
grateful for
I
this
would like to
opportunity to
introduce
be
our
part
company.
of this PHA's four-part virtual webinar. And to make things move
The Call
forward,
Group
I would
Holdings
like to
Corporation
introduce our
is a
company.
world-class conglomerate of companies that is a pioneer builder and mover of
The
creative
Call
and
Group Holdings
innovative
Corporation
solutions
is a
for all
world-class
local,
conglomerate
national,
of
and global
companies
and
that is a
associations.
pioneer
We,
builder
along
and
with
mover of
PHA's
creative and
intention, will
innovative
provide the
solutions
latest updates
for all
on
local,
vital
national,
matters
and global
regarding
companies and
healthcare-based
associations.
activities.
We are one of the
Call Group
PHA's
Call
intention
Group will
to
be glad
provide the
to be part of
latest
solution,
updates
bridge the gaps,
on
and
vital
mitigate
matters
challenges with our
regarding
partners and
healthcare risks and
subsidiaries.
pitfalls. Call Group will be glad to
These
be
are the
part of the
companies
solution to
under
bridge the
the
gaps to
Call
answer
Group
these challenges
Holdings,
with our
and
partners and
each
subsidiaries.
business units are composed of reputable organizations.
So these are the
that has
companies
served the
under the
industry
Call
of
Group
hospitals
Holdings,
and
and
healthcare
each
industry.
business units
So
are
let me
composed of
start with the
reputable
front runner of
organization
our
that
company.
has served the
It's
industry of
Sammeds Medical
hospitals and
Corporation.
healthcare industry.
It consists
So
of
let
two
me start
divisions,
with
which
the front
offers a
runner
brand
of
new
our
medical
company. It's Sammeds Medical Corporation. It consists of two divisions which offers a brand new medical
have an ESWL for the urology for hospitals and clinics. Sammeds can provide radiology machines
have an
with
ESWL for the
artificial
urology for
intelligence
hospitals and
technology,
clinics.
and we also
Sammeds can provide radiology machines with
various medical equipment and
artificial
devices
intelligence
on a
technology,
per
and we
department
also
basis
set
as
up
the hospital
can
needs
set up
for operating
various
rooms,
medical
emergency
equipments
rooms,
and devices
intensive care
on a
units,
per department
dialysis
basis
centers,
as the hospital
radiology
needs for
centers.
operating rooms, emergency
Sammeds is
rooms,
also the
intensive care
leading
units,
company for
dialysis
medical
centers,
simulation services.
radiology
For
centers.
hospitals, we have the laboratory
Sammeds is
simulation,
also the
and our
leading
medical
company for
simulation
medical
services are being
simulation
used by
services.
most
For
medical
hospitals,
schools,
we have
such
the
as University
laboratory
of San Tomas,
simulation,
University of
and
Philippines
our
College of
medical
Medicine,
simulation
Davao
services
Medical,
are being used by
Tata
most
State
medical
University, San Beda
schools
State University,
such as University of Santo Tomas, University of the Philippines College of Medicine, Davao Medical, Batangas State University, San Beda State University, Perpetual Health, FEU, NRMF, and a lot of big national universities. We cater for different private and public national universities all over the country. The Anatomage table, as you see, is used to augment and complement anatomy dissection experience of medical students, which is the front runner of the Sammeds Medical Company. We are also exclusive distributor of Lardal simulations, Kyoto Kagaku, Sindaber, Athena, and Med Simulation on healthcare education.
Longwind medical equipments. Next would be JAR Med Medical Networks.
Another
and mobile
product
diagnostic
is we also are a
We provide the
distributor of
diagnostic
Longwind
services
medical
such as laboratory
equipments.
examinations
Next
and
would be
other
JAR Med
laboratory
Medical
activities.
Networks and
Of
mobile
Kagaku
diagnostic
Lab,
services.
Multi-Capacity,
We provide the
with
diagnostic
X-ray
medical
laboratory
services such as laboratory examinations and other laboratory ancillaries. We also have a mobile van with full training capacity, equipped with X-ray and laboratory services. Another arm is our Philippine Medical Depot, which is a full-line hospital medical equipment, devices, and supplies showroom that caters for public and other private healthcare facilities and companies.
Which provides calibration.
We're going to present you another arm is the medical equipment calibration services, which provides calibration, verification, preventive and corrective maintenances, project management. We also help on hospital workflow, construction, and consultancy services. Aside from that, we also do technical and online support. Another services that we can offer is the Philippine Exponents for Business Products and Solutions. This company provides access to many other local and international medical companies that needs assistance to register their products at our local FDA, thus making the product compliant and be commercially available here in our country. We also provide consultancy services and outsource marketing strategies on logistics to many other companies in promoting trade and business relations, such as ISO accreditation and other local and international affiliations. Next is our service on ICAS, which is the International College of Allied Health Science and Technology. The services that we provide is a TESDA registered training programs and online progress assessment for health sector workers such as NC3 pharmacy assistant, NC2 biomedical tech, EMS, barangay health and healthcare caregiver services, for BLS and ACLS training programs as well.
It is a hub for informational.
Another arm that we are all excited about is the Innovaret Tech Systems. It is a hub for information technology solutions to cater for each and all hospital departments on information system technology. This unit homes the most promising advancement of healthcare technology to bridge the gap on the understocked healthcare units, which is a big challenge to the hospitals right now. So the latest in the pipeline is our artificial intelligence in healthcare. So we have on the pipeline is the neonatal ICU AI, the AI in cardiology. We also have the radiology, the spine, breast radiology, pathology, urology, and infectious disease. We had just a recent meeting with one of our providers that has pioneered using the IoT or Internet of Technology and AI in 4 hospitals in United Kingdom and India. And we are excited to share this wonderful opportunity to all our hospitals out there to be part of the Philippines clinical research on AI. The AI project will be more elaborated by Mr. Glenn Lorente in a while. Moving on to our next business unit is the SETC, which is the Smart Enhanced Technology Service Incorporated, which provides an environmental technology system to general waste management. The technology we use are waste-to-energy technology, and we're also building solar panels to hospital. We also have the state-of-the-art magnetic plasma system as an alternative green solution on handling medical waste. We're going to take you to EPA Academy, which is the top-notch training provider in healthcare engineering and corporate revitalization. EPI has an experienced professional trainers who provides hands-on and engaging trainings, consultancy, and competency training to enhance the skills of our healthcare workers and to also promote practical applications of tools for best practices. Another training arm will be Belcom. Belcom Technologies has been a vanguard in the biomedical engineering realm, and we know that we will provide a great value in the hospitals. Belcom offers biomedical engineering maintenance services, calibration and repair services of hospital equipment rental and plant preventive maintenance, facility engineering maintenance services, and radiation management. Lastly, the Carl Medical Group is again, as you have seen, is a world-class conglomerate of companies that is the pioneer builder and frontrunner of bringing the most advanced technology and strategies and the mover of creative and innovative solutions. Carl Medical Group, with its affiliated companies, integrate a healthcare ecosystem. We have a growing global partnerships. And we also have a goal of bringing the company's vision to be made available for the public to deliver the growing demands of the healthcare industry. For Call Group Business Model presentation, my colleague, Mr. Glenn Lorente, our Director for Special Projects, will now take on the lead.
Thank you, Dr. Happy. Thank you. Thank you, Dr. Happy, for your That's the presentation of generative AI. So how AI is revolutionizing healthcare? So AI is primarily utilized to increase speed and accuracy in the healthcare services. By the way, AI is pronounced as I in Japanese. I means love. So AI technology indeed is love for the healthcare community. It has the potential to bring about significant benefits and improvements for patients, such as early diagnosis and personalized treatment, predictive analysis, enhanced imaging and diagnostics, virtual health assistance, remote patient monitoring, drug discovery and development, administrative efficiency, personal health management apps. So generally, AI is not a new concept. It's been around for a while. How many of you have used or familiar with Google Translate? It was launched for the first time in year 2006. It's been around for 18 years. The other apps in the slides are example products of generative AI. Hey Siri, of our phone. Another example, when the phone attempts to complete your sentences, attempts to think like you, and it saves your time. Saves your time, right? So that is precisely similar to the purpose of employing AI in healthcare, to save time and speed up the process, to save lives. So let's start discussing with Carl Group's first AI product, AI solution for cerebrovascular diseases. So as shown in the image, AI can analyze medical imaging data, such as CT scans and MRIs, to quickly and accurately detect signs of stroke. This helps in early diagnosis and timely intervention. Next product is AI in breast cancer detection and breast imaging. AI can help detect abnormalities and lesions that may be indicative of breast cancer. As we can see in the medical image, AI highlights areas of concern. That's the ground photo. Next product, AI solutions for cardiology. As shown in the image, AI can analyze cardiac imaging data, such as echocardiograms, MRIs, and CT scans to detect abnormalities, assess cardiac function, and aid in early diagnosis. Improved ECG powered by AI that can do ECG reading and Holter. That's the image on the right side, upper right side. That is an improved ECG powered by AI. We have that product. Next product is the AI solutions for infectious disease. In the sample image, the bacteria are quickly identified by applying AI that could lead to accurate medication at an early stage. According to WHO, roughly 50 million people suffer from sepsis, and about 11 million dies annually. So that is how crucial to identify the cause of infection as early as possible to start the treatment. AI identifies the bacteria from image taken after 1 day, of blood culture complete 3 days. And with AI, it only needs 10 seconds to get the result and start with the accurate treatment plan. One example also when the scientists in the US used AI during COVID pandemic. Next product is the AI solution for lung nodules detection. As shown in the image, AI can segment lung nodules from medical images, providing a precise delineation of the nodules. The segmentation is crucial for further analysis and measurement of nodules characteristics. Next product is the AI solution for multiple chest diseases, such as lung nodules, pneumonia, and other. AI analyzes chest X-rays to detect abnormalities, such as lung nodules, pneumonia, and other chest diseases. By the way, those bullet words on the left side, that's the other way we can apply AI for this specific disease. Next product is the AI solution for spinal diseases. AI can analyze medical imaging data. Next product is the AI solution for pathology. So as shown in the image, AI easily recognizes patterns and anomalies in the affected cells. The affected cells, as we can see, are highlighted with blue color. So there's a normal image and image after applying AI. Next product is the AI solutions for spinal diseases. So AI can analyze medical imaging data, such as MRI and CT scans, to assist in the detection and diagnosis of spinal diseases. This analysis can identify abnormalities such as herniated disc, spinal tumors, or degenerative conditions with high accuracy. Next product is the AI solution for radiology. An example for this is the AI in the detection of TB. The system separates from the normal X-ray, from the pathologic X-ray. 90% of the X-ray will be normal. Then the radiologist will read by priority. The remaining 2% which is pathology. So the AI shortens and speeds up reading the X-ray film. Next product, and the last product, we offer in Carl Group of our various AI products, the AI solutions for tele-ICU. Tele-ICU in intensive care units involves the use of technology to provide remote monitoring and care for critically ill patients. AI plays significant role in enhancing ICU solutions by providing real-time data, predictive analysis, decision support, and automation. As we can see in the image, this is the automation. The doctor can monitor anytime, anywhere, and can make decisions based on the findings of AI. Carl Group will do pilot study of our AI technologies for anyone interested in hospitals. So Carl Group is hoping that this bold step in healthcare will offer more significant benefits. Pooling knowledge, data, and resources could expedite breakthrough in testing and implementing new solutions or technologies. So the ultimate beneficiary will be the Philippines and the Filipino patient community in general. We would like to ask any esteemed hospital member of Philippine Hospital Association interested to be included in our pilot study. Please contact us in Carl Group. Our contact detail is available in the chat box. My next presentation is about the business models that we do and we apply in our business. So this team hospital owners that would be interested to our products and services, we offer the following models. First model is the consortium. So Carl Group and other groups can join together for a common cause, such as lower the price, improve products offered in the same industry. Example, PJ, PMA, PHAPI, and MDAP can work together to achieve a common objective. Next model, we have the PPP. We are all familiar with this. So Carl Group coming into a public facility to invest and operate projects or services. So no cash out from the government agency partner. Next model is joint venture. So Carl Group and other businesses come together to collaborate and pool the resources to achieve a specific business goal and undertake a particular project. There is equity involved in this kind of business model. If engaged with the government project, just to distinguish with the PPP, there will be cash out from the government side. So example of this, we set up, there is a center, we have center, laboratory, and the like. Next model is list-to-own tie-up and pay-per-use, or the PTU model. The list-to-own model, product or property is offered for lease with the option to purchase for a specific period. There is target to be achieved for a certain period. The tie-up usually involves consumables that will be supplied by one party. There is no definite period. In PPU, or the pay-per-use business model, there is also target reach. Companies being paid upon use of property or product. We recently installed plasma sterilizer under the PPU model, knocked out from our hospital client. Last model is the direct sales. Under this model, the hospital client will have flexible payment terms agreed upon, such as 30% down payment, then balance will be paid 10% prior to shipment, 10% upon delivery, 10% upon installation and full acceptance, and the remaining 40% will be payable for 4 months. Thank you.
Thank you.
Thank you, Sir Glenn.
That is very informative. Wrap up soon. Business model. model conceptualized by
That is very informative, Sir Glenn. The artificial intelligence business model and other business model conceptualized by the group is really amazing to learn. We want to share to you more information about it. We have the email on the chat box. But to wrap up and everything we would like to share to you, the companies, both public and national companies that we have been serving and trusting us for all over the years. So to mention a few, government hospitals from different provinces, example for Muntinlupa, from Bohol, Iloilo, Dipolog, the private hospitals, St. Luke's hospitals, Makati Med, Chinese General Hospitals, the government affiliated
Cebu Normal University, Isabela State University,
medical schools in different provinces. And, to name a few, the Cebu Normal University, Isabela State University, Pamantasan ng Lungsod ng Muntinlupa, Mindanao State University. From north to south, we have been servicing these hospitals and medical schools. Next. Yep.
So, to wrap up, I will end the standpoint of
to wrap
the
up,
company,
I will end
from Philippians 1 verse 6.
A standpoint of the company, which is from Philippians 1 verse 6. He who began a good work in you will bring it to the completion at the day of Jesus Christ. So Carl Group Company is a Zebra company which is highly sustainable and profitable company that gives back to the society. We are a highly transformative and a spiritual company. And with all of the time that was given to us, as a token of gratitude, the Carl Group Company would like to offer a free license to use our Healthy Mind software, which is worth 7,000 pesos, will be given to all who are interested, to our hospital partners. Actually, Healthy Mind is a web-based online mental health program to overcome anxiety and depression using the cognitive behavioral therapy approach. It is a comprehensive mental health solution for individuals and companies and medical professionals. Again, I will send the link for our email for all the hospitals and partners if you would like to avail of this token of gratitude for Carl Group companies. With all of this, we thank you for your time and attention.
And also its representatives for presenting about your company.
Very much to Carl Group and its representatives for presenting about your company. And the attendees may have questions for you, and coming up is the open forum, so you may join that, or you may also reply in the Q&A box. Now, before the open forum, we are sharing the evaluation form link. So refer to the chat box for the link, or you may scan the QR code now flashed on screen. So please accomplish this evaluation form and post-test. Of course, we need your evaluation for more ideas of an improvement of this webinar series. Again, please refer to the chat box for the link. We are now heading to the open forum, and to facilitate that, really there's no need for an introduction. Our moderator is attorney Dr. Bu Castro.
Thank you, and welcome to the open forum portion of our webinar. And thank you very much to our speakers. And yes, we're now formally receiving questions through our Q&A room. And let me ask the first question.
Let's try to balance out
It would seem, puro ano na naman to, PhilHealth na naman. Anyway, let's try to balance out everyone. The first question is to
from Dr. Narciso.
Let me see. Query for PhilHealth. So from Dr. Narciso Tad Siokson. Malapit lang kamag-anak ni Dr. Chicho ko ito. So
no longer
is the
applicable
pay,
for admissions
well,
starting
whichever is
February
lower
14,
policy,
2024.
no
And the
longer
second one is how
applicable for
about
admission
for those in
starting
Annex C,
February
the
14,
excluded
2024.
benefits?
And the second
Should we
one is how
use
about for
pay
those in
whenever
Annex
lower or
C,
full case
the
rate,
excluded
meaning the
benefits?
adjusted rate?
Should we use
Madam Abigail,
pay whenever lower or
I think
full
this question
case
is for
rate,
you.
meaning the adjusted rate?
Thank you, Dr.
Madam
Castro, and
Abigail,
thank you also to Dr.
I think
Narcis.
this question is for you.
As implied in
Thank
Philippine
you,
Circular number
Dr. Castro, and thank you
2024-001,
also to
with
Dr.
the
Narciso.
adjustment in case rates,
As
PhilHealth
implied
shall
in
pay
PhilHealth Circular number
the claims
2024-001, with the
case
adjustment in
rates.
case rates,
So,
PhilHealth shall pay
whether
the
the
claims
charges are below
in full
the case rates, we
case
will take
rates.
full.
No, so
And
whether
the
the
second one po,
charges
no, for
are
the
below
exclusion,
the case rates, we will
for
state
those
pay in full. And
conditions under the excluded
the
benefits,
second one po, no,
with
for
the
the
implementation
exclusion,
of
for
PhilHealth
those
Circular on the
conditions
rationalization of
under the
case rates in
excluded benefits,
2023,
with the
for those
implementation of
excluded in that
PhilHealth
30%
Circular on the
adjustments,
rationalization of case
they
rates in
will still be paid
2023, for those
as
excluded in that
case-based
30%
payment. We will be still
adjustments,
paying the claims
they
using the
will still be paid
case-based payment.
as
Hence, it will be
case-based
paid.
payment. We will
So
be
they are
still paying the
excluded.
claims using
They
the
are excluded
case-based
in this
payment.
adjustment because we will
Hence,
be
it will be paid
implementing
in
the
full, although they are
adjustments
excluded.
this year.
They are excluded
And
in this
that's why they were
adjustment because we
included in
will
the
be
excluded
implementing the
benefits for 30%.
adjustments
Because we are
this
doing
year, and
robust costing
that's why they were
methodologies to
included
come
in the
up with
excluded benefits for
enhanced
30%,
rates or
because
new
we are
rates for
doing
those excluded
robust costing methodologies
conditions
to come up
accordingly.
with the
Thank you po.
enhanced rates or
So
new rates for
let me
those
clarify,
excluded
Madam Abigail.
conditions as
The
identified.
listed
Thank you po.
adjusted rates
So
are now
let me
available
clarify,
for viewing
Madam
or
Abigail.
downloading
The listed
from the
adjusted
PhilHealth
rates
website. Is that
are
right?
now available for
Yes, sir.
viewing
It is
or
already available.
downloading
But
from
it
the
is not yet
PhilHealth
complete.
website. Is that right?
It's already
Yes, sir.
complete, sir.
It is
We
already
have
available.
Annexes A to F,
But it is not
wherein
yet
Annex
complete.
A is the list of
It's already complete, sir.
medical
We have
conditions.
annexes A
Annex
to
B
F,
is the list of
wherein
adjusted
Annex A is
surgical
the list of
procedures or procedure codes.
medical
The
conditions.
Annex C is
Annex
for
B is
the
the list of
excluded
adjusted
conditions
surgical
because
procedures
those
or
are the
procedure
conditions
codes.
being
And the Annex C
reviewed
is
now
for the
or
excluded
requested for
conditions
implementation also
because
this year.
those are the
And
conditions
there are
being
also
reviewed
included
now
also in
or
the
requested
website
for
is you can
implementation also
download the
this year.
annexes for the
And
second
there
case
are
rates.
also included also in the website is you can download the annexes
So with
for the
the
second case
rules for
rates,
implementing the case
po,
rates,
no,
so
and those being
the
claimed by
rules
primary
still
care
exist, only
facilities.
that we
So
adjusted
with the
the
rules
rates
for
to
implementing the
30%.
case rates po, the rules still exist,
There is still
only that we
possible that
adjusted
there may be
the
changes.
rates
Is that
to
right?
30%.
Yes, sir, because for
So
this year,
there is still
those
possible that there may
included
be
in the list
changes. Is that right?
for
Yes,
excluded
sir,
benefits
because
will be implemented
for
also
this
this
year,
year. We
those
are already
included in
reviewing
the
those
list for
identified case
excluded
rates
benefits will
and
be implemented
being
also this year.
subjected for
We
approval
are
to
already
board
reviewing
for
those
implementation of the new
identified
rates.
case rates and being
Okay, which brings
subjected
me
for
to the next
approval to
question,
board
Miss.
for
From
implementation
Vivian
of the new
Suarez.
rates.
What about the
Okay,
OPD?
which brings me to the next question is
Is it
from
also
Vivian
a part of the
Suarez.
adjusted
What about
case
the
rate?
OPD?
For those
Is it
outpatient po,
also a
Yes.
part of the
for
adjusted
those
case rate?
cases paid na nasa
For
outpatient
those
po, kasi
Go
meron
ahead.
tayong
outpatient po,
identified na cases
Yes.
outside
for those
yung
cases
limits
paid
natin
na
mga
nasa
mga
outpatient po, no? Kasi meron
This
tayong
is
identified na
yung hindi
cases outside
necessitate ng
yung
admission
mga
but
admissions
paid
natin
as
like mga
case rates.
cataract, yung
Kasama rin po yan, sir.
hemodialysis, yung hindi
Okay, so adjusted
nag-necessitate
sila.
ng
Ano
admission
yung
but paid
typically
as case rates, kasama rin po yun sa na-adjust.
set forth in
Okay, so
the
adjusted sila.
in
Unless
the
it's
listed
specifically
rates na hindi sila kasama po.
Yes po.
set
Okay,
forth in
okay.
the
So the next question is
listed
still for you.
rates
Is
na
the
hindi sila
30%
kasama doon.
adjustment?
Yes po.
This
Okay,
was already
okay.
answered.
So the next
So
question
let's
is
see.
still for you. Is the
It's
30%
for Sir
adjustment?
Glenn.
Oh, this was already
You have
answered. So
developed
let's see.
AI
For Sir Glenn,
of the ancillary section
you have
of the hospital.
developed
There
AI
are AI support for
in almost
declaration
all
and
of the
dietary
ancillary
services
section
like
of the
that.
hospital.
So, Sir Glenn,
Is
this
there
is
an
our
AI
request.
support for the nutrition and dietary services in line? So, Sir Glenn, this is a question for you.
Now, we don't have such product.
Okay, I will be using the
Concerning
laptop
for now,
of
concerning
Dr. Happy.
nutritionist
Now, we don't have such product now in concerning for now, concerning the nutritionist, the nutrition and
Recognition like you can see my
dietary.
face right now.
We don't have.
So automatically
So there's
the AI
no, for
will
example, a face
prescribe to me,
recognition, like you can see my face
you
right
only
now.
eat this following
So
vegetables.
automatically the AI will
Something like that.
prescribe to me,
It's like a
you reduce, Dr.
generative
Boo.
AI.
You only eat this following vegetables. No AI like
Yes, I was
that.
about to ask you
It's
what
like a
about
generative AI attorney doc
qualification
now.
for Miss Philippines. Can you
All
accept
right.
as an
Because I
AI?
was about to ask you, what
So
about
anyway,
qualification for Miss Philippines? Can you set that as an AI also? So anyway,
That would be a
we will have
good
Mr. and
next
Miss
project,
Philippines,
Dr. Boo, and we will
Mr.
have
and
you
Miss
to chair
PHA for this
the project.
anyway, we will have Mr.
You
and Miss
you might possibly
Mr.
ask
and
for
Miss
this
PHA for this
AI.
year.
Yes, attorney.
Launch that,
Okay.
okay? We
So
might
do you offer
possibly ask your
preventive
assistance
corrective
for
maintenance
AI.
Yes, attorney.
of the medical
Okay.
equipment?
So do you offer
Acquired
preventive
from your
corrective
company.
maintenance
So do you do that?
of the medical equipment?
Yes, we do
Not
that
not
under
acquired from your
group
company.
of medical
So do you
group
do
under
that?
MedLabs.
Yes,
Yes, upon
we do
evaluation
that
of the
under
machine, yes, we do. We
group
do and
of
provide solutions
medical group
for
under
preventive and
MedLabs. Yes,
corrective
upon
maintenance. And
evaluation
in
of
fact,
the
we have a
machine,
lot of
yes, we do and provide
hospital
solutions
clients
for the
who
preventive
ask for
and
services.
corrective
You will
maintenance. And in
not
fact, we have a
purchase
lot
from
of
your company, huh?
Yes,
hospital
sir.
clients
And
who ask
yes,
for
doctors.
services.
Even not purchased from
For
your
Madam
company, huh?
Abigail,
Yes,
again,
yes,
you have
sir,
with
and
regards
attorney.
to
Yes, doctors.
Administrative
Okay.
Order 2020
For Madam Abigail, again, PhilHealth, with regards to Administrative Order 2020-0043,
Anyway, so let me ask a
bakit
question
nawala
from the
yung aking
anonymous
binabasa?
person.
Anyway,
How about the
so let me ask a question from the
non-PNF-approved medicines?
anonymous
They are not to be
person.
deducted
How
from
about the
hospital bill
non-PNF
anymore?
approved medicines?
Madam
They are
Abigail, I
not to
guess
be
this is a question
deducted
for you.
from the gross hospital
Thank you for
bill
that
anymore?
question po, no. Still,
Madam Abigail, I
we
guess this
follow
is a
the rules,
question for
no,
you.
on paying
Thank you for that
tax.
question po,
The
no.
policy of PhilHealth
Still,
as
we
stipulated
follow
po
the
dun
rules,
sa
no, on
batas, no,
paying
the
non-PNF
NHIP law,
drugs.
that
So the
all
policy of
non-PNF
PhilHealth as
shall not be
stipulated po doon
covered
sa
by PhilHealth.
batas, no, the NHIP law, that all
However, you
non-PNF
have to,
drugs shall not be
for the
covered
purpose of
by
submitting
PhilHealth,
the
no.
statement of account,
But
all
however, you
medicines
have to
that were
first, for the
provided to
purpose
the
of
patient should
submitting
be included
the statement
in
of
the
account,
list, no?
all
Kasi we are requesting also
medicines
for the
that
itemized
were
billing
provided
statement.
to the patient should be
So yes, we
included
still
in the
cannot
list,
pay
no?
for
Kasi we are requesting
non-PNF
also for the
drugs.
itemized billing statement.
Okay,
So
now I
yes, we
understand
still
this
cannot
chat
pay
room.
for
So
non-PNF
pag nasagot na
drugs
pala,
po.
nawawala yung binabasa ko.
Okay, now I understand this
So,
chat room. So pag
again, from
nasagot
an
na pala,
anonymous
nawawala yung
attendee,
binabasa ko.
with
Okay,
respect to
so
discounts,
again,
like
from an anonymous
PWD and
attendee,
senior, since we have a
with
scenario
respect
about
to
one patient
discounts
who have
like
just been
PWD
diagnosed
and
with
senior,
disability.
since
She
we
was
have a
admitted
scenario about
February
one
28
patient
to March 7,
who have just
2024.
been diagnosed with
Parents got a
disability. She was
PWD
admitted
ID
February
with
28 to
effectivity
March
of
7,
March 5,
2024. Parents got a
2024 to March 5,
PWD ID
2029.
with
Question
effectivity
is,
of March 5,
when are these
2024
questions
to March
with
5,
regards to
2029.
discounts? Since
Question
we have a
is,
scenario, one
when
patient who just
are
diagnosed
these
with
questions
disability.
with regards to discounts? Since we have a
Do you
scenario, one
understand the
patient who have
question?
just
The
diagnosed
question is,
with
what dates
disability.
are we going to extract or
Do you understand the question? The question is,
give a
what
discount?
dates are we going to
What's the date?
extract or probably to
Did you understand the question,
give
Madam
a
Abigail?
discount.
What
What is the date?
I think she was asking
Did
if
you
what is
understand the question,
applicable
Madam
date
Abigail?
to
I didn't
honor
What
quite get.
the discount.
I think
Tama po
she
ba?
was asking if what is the applicable
Well,
date to
If
honor
for
the
PhilHealth
the
purposes po,
discount.
if
Yes.
Tama
once
po ba?
admitted po
Right.
yung
Uh,
patient
Go
na
ahead.
with
if
disability
for
and availing for
PhilHealth
discount, it should be
purposes
within the
po, if
validity of
once
the
admitted po yung patient
ID,
na
PWD
with
or
disability
senior
and
citizen to
availing
that
for discount,
effect.
it should be within the
No? So
validity
we
of
can consider
the
when
the
it is
ID,
valid po.
PWD or senior
No?
citizen
Upon
to that effect.
during admission, it should be
No,
valid
so we
so
can
that
consider when
the
it
discounts
is
shall be affected
valid
to the
po.
cost
No,
of
during
yung
admission, it should be
patient.
valid so that the discounts shall be
Alright,
affected
so
to
I
the
think it's the last
cost of
from
yung
the
bill po ng
unanswered
pasyente.
question. Good
Ayan.
afternoon. With
Okay.
reference to
All right. So I think this is the
OPD,
last
ER services
from the
like
unanswered
hemodialysis,
question. Good
other
afternoon. With
repetitive
reference to
procedures, and
OPD,
ER
ER
services
services like
suturing, are they
hemodialysis,
subject to
other
no OP
repetitive
policy
procedures,
as well, even
and
though they
ER
are not
services like
inpatients, that they do
suturing,
not
are they
choose
subject to no
their
copay
own
policy
doctor
as
in
well, even
government
though they are
hospital
not
facilities?
inpatients, that they do not choose their
Question.
own
Are
doctor
they
in
subject to
government
no copay
hospital
policy
facility?
since they are not inpatients?
The question, are they
Okay,
subject to no copay policy
for that question,
since they are
sir,
not inpatients?
as it's
Okay,
stipulated in the
policy
policy
yung-
now,
for that question,
services
sir,
within, if that services was provided
as
to
it's
a public
stipulated in the
hospital,
policy now,
and
if that
that services are the
services
minimum
within or if
standards
that
of care,
services was provided
it is
in a
considered
public
as
hospital
to
and
have no
that
copay
services are the minimum standards of care,
as
no,
being
it
stipulated in the
is
policy.
considered as
So if those
to have no
minimum standards
co-payment,
of care are being
no,
provided
as
in the public
as being
facility,
stipulated in the
they are
policy
not
of
admitted,
PhilHealth. So if
they
those
should not
minimum or standards of
pay
care
for
are being
other
provided
fees,
in the public
for the
facility,
services
even if
provided.
they are not admitted, they should not pay
So
for
this one is
other
very
fees,
important.
no, for the
For
services
private
provided.
basic accommodation,
Okay,
no balance
so
billing
this one is very
pertains to
important.
no balance
For
billing,
private
including
basic
assistance from government
accommodation,
agencies.
no
Is
balance
that
billing
correct?
pertains
Or
to
if
no
it is still
balance
can
billing,
suppose the
including
hospital
assistance
bill
from government
went
agencies.
beyond
Is that correct?
the hospital
Or
bill
it still can,
went beyond the
suppose
case
the
rate.
hospital
Can
bill
they still avail of
went
government
beyond,
agencies assistance
the hospital bill went beyond the
to
case rate.
cover
Can they
the
still avail of
balance
government
the no
agencies
balance
assistance
billing rate?
to cover
In a private facility,
the
yes or no?
balance of the no balance billing
If
rate?
the patient is admitted
In a private facility, answer, no?
Yes,
accommodation,
yes.
If the patient is admitted in a private facility in a basic accommodation,
but yes, if there are
tama po,
available
they should not be
fund
charged
sources that
on top of case rates. But yes, if there are available fund sources that that were in the charges on top of the case rate can be sourced out po to complement. It could be helpful to the patient since syempre po sa private hospital we rely on the resources po no ng private facility, but then again as per law talagang kailangan mag-provide tayo ng basic accommodation at least no yung sinasabi nating 10% of the bed capacity. So if there are available fund source that we can source po yung other expenses, that would be helpful po. I think meron din naman. Opo, MAIP or yung pong malasakit if it is available, we can source to that funds po nila.
In addition to the case rate.
Yes po.
Okay.
So if the rates or the cost of care is beyond po no doon sa case rates na available.
Ito gusto niya ma-clarify maigi.
Okay.
Kasama po ba sa adjustment rate ang chemotherapy at cataract?
Okay. For cataract po, isa po yan sa kasama sa excluded from the 30% because that is being recosted now. So we will be implementing the enhanced rate for the cataract for this year. So it is being reviewed po. Kaya po siya nandun sa exclusion. And for the chemotherapy naman po, we will also we are reviewing now the chemotherapy, but for specific cancer po, only for liver, lung, ovary, and prostate. So we are also reviewing that now and for implementation this year. Other than those sites po, no, apart from yung 4 na nabanggit ko, they were included in the 30% adjustment.
Okay. O naboboard na si Dr. Moni Chichoko. Walang question pa sa kanya. So anyway, can we discount senior citizen even without senior card? Kung puti na lahat ang buhok niya, halimbawa, ugod-ugod, ubo-ubo, hanapan pa ba siya ng senior card?
Sunod yung challenges.
Madam Abigail?
O ano pa ba siya ay will he be given discount? Madam Abigail?
For purpose po kasi,
Senior citizen na walang
senior citizen po, no? For PhilHealth purpose po kasi, kailangan maipakita niya na PhilHealth member siya. Kasi for senior citizen po, para ma-member po siya sa PhilHealth, kailangan po rin talaga
hindi na po
kung wala po siyang ID but registered siya sa PhilHealth as senior citizen, hindi na po kailangan ng senior citizen's ID niya. Meaning, nakapag-submit siya nung documents na yon, kaya nagkaroon siya ng kanyang PhilHealth ID number. That would suffice po, no? But of course, siguro sa policy ng hospital, we have to review. Kasi nga, lahat naman talaga ng senior citizen, kailangan din silang magpa-member sa PhilHealth para ma-record po. Although hindi naman sila required magbayad kasi the government pays for their premium po, no? Kasi automatic po yun, lahat ng senior citizen, mamemember sa PhilHealth once they register. So, if yun nga, yung puro uba na nga siya, talagang makikita natin matandang-matanda na siya, we have to verify if kung wala siyang ID as senior citizen but naka-register siya sa PhilHealth, I think that would suffice na hindi siya ma-deprive ng benefit niya.
Diretso sa hospital.
Yeah, palagi ko galing siya sa bandang Tabuk o Benguet or probably diretso sa hospital siguro. Okay.
Dr. Bonnie.
Tatanong niyo yung iba dito.
Can you share the challenges?
Ito.
You
Dr. Bonnie.
in implementing the IPPC programs.
Can you share the challenges you encountered in implementing the IPPC program?
Challenges in
Yes.
implementation. Yeah, good afternoon. Thank you for the question. Of course, everyone would have challenges in implementation, but what we really is worried about is the increased attrition rate among healthcare workers. So we have, of course, if there is an increase in attrition rate, more people would be not oriented or does not have any idea about the infection prevention and control. But we did a solution for that because what we did is we continuously train and there is a weekly orientation of newly hired personnel. Another challenge is, of course, the compliance to the policies. Number one is on the proper waste segregation. We still find some cases, isolated cases of non-compliance to the disposal of the sharps, such that there are some workers that could encounter needle prick injuries. But we have already instituted measures to reorient and orient again all of the healthcare workers handling this infectious waste materials. And another one is the, of course, compliance of the patient's relatives to our policies. We really need to, educate, do everyday teachings in the wards so that all of the patient's relatives would be aware that there is a policy on infection prevention, especially on hand hygiene, because this is one of the what we were able to identify is the source of healthcare or healthcare associated infection among patients in the ward is the, of course, the lack of practice of hand hygiene, especially those relatives that are handling patients with wounds or surgical patients. So our overall solution is the implementation of our infection prevention control caravan, which includes patients and watchers that are educated or daily.
Thank you, Dr. Dichopo. We go back to Madam Abigail.
Thank you, Dr. Dichopo. We go back to Madam Abigail. Regarding po sa no balance billing, doctors fee po ba ay included or sa hospital side lang? In other words, pwede pa bang maningil yung doktor?
Madam Abigail.
Pag beyond the
Thank you, sir, for that question.
case rate,
Regarding the NPP po, no?
Madam Abigail.
For those patients
Thank you, sir, for that question regarding the NDP po, no. For those patients na for the doctor's fee po, no. If the patient is admitted in a public facility or government facility and in a basic accommodation po, that includes no charging, and that includes doctor's fee. So wala po talaga dapat mababayaran. However, if the patient is admitted in a public and in a non-basic accommodation, they can charge professional fee, but not to exceed the maximum So kailangan i-note lang po yung kung magkano yung case rates na applicable. Pwede kasi po na magkaroon din ng on top of case rate pa rin yung hospital fee. So, ano na lang po yun, mag-allocate na lang po both yung hospital fee tsaka PF. But for patients admitted in a private facility po, no, they can charge naman po on top of the case rate. Kailangan lang po talaga this is in discussion with the patient para alam po ng pasyente kung magkano yung in-expect na babayaran niya. Ayan po.
Okay. From Ciudad Medical, Zamboanga through Attorney Jihan Natividad, can the excess from case rate payments of previous years before 2019 specifically be applied for payment of balance bill from application of no balance billing?
Excess payment
Madam Abigail?
Yes.
For the excess po na excess payment for the NBB?
Yes. The previous year, so before 2019.
For payment of balance bill from application of
Can be charged to
Can it be applied for payment of balance bill from application of no balance billing?
So for those conditions kasi pwede,
since we will be paying na po in full case rates po, no? So for those conditions kasi pwedeng merong deficiencies yung hospital, so they can use it to implement the no balance billing in the facility if they are implementing it. So this is in particular po sa mga government facilities po and even in the private facilities. So they can use those other yung amount po ng case rates na nakuha nila, no? Kung ang services naman is lower than the case rate, they can use it as efficiency gains to continuously implement the CQI or even augment for the no balance billing for those patients admitted in basic accommodation.
that your IPC
All
staff
right,
is
thank you for
using?
Dr.
Were
Chichoco
you
again
the one who
for the
developed this, or
monitoring
did you
checklist
use a standard
that your
checklist?
IPC staff is using.
So we
Were
are the
you the
one
one
who
who
developed
developed
the
this,
checklist,
or
and the
did
checklist
you
is
use
based
a
on
standard
it is
checklist?
created by our
So we are the one who developed the checklist, and the checklist is based on it is created by our Infection Prevention and Control Committee, and it is based on the different parameters such as compliance in hand hygiene, healthcare waste management, utilization of bundles of gear, sharps, and safety, environmental care, and all of this is based on the World Health Organization and the Center for Disease Control guidelines and other guidelines set
Mr.
forth
John
by the
Michael
specialty
Bernino,
societies.
the solar panels
Okay.
and installation
For
are free.
Mr. John
Is that
Michael
correct?
Bernil,
And
the
we
solar
only pay
panels
the energy
and
consumption
installation
and rate,
are free. Is
6
that correct?
pesos or 7
And
Yes,
we
pesos
only
per
pay the
kilowatt
energy
hour.
consumption
yes,
and rate
that's correct. On our
6
side,
pesos or
for our
7
solution, we don't
pesos
charge
per
anything
kilowatt
to
hour.
install the solar panels. Yes, that's correct. So on our side, for our solution, we don't charge anything to install the solar panels to your facility. So all you need to pay is when the system is operational, yung energy that produced by the solar panels, which is lower than the rate that you're paying with your utility. So usually our rate ranges from 6 pesos to 7 pesos. But this can be lower or higher depending on the condition of facility natin. If you have to do retrofitting, the cost is higher.
To the electric,
Yeah, let me just
to
clarify. So your system, solar
Meralco, for
panel
example,
system,
in
is
Manila.
still connected to the grid, to the electric, to the Meralco, for example, in Manila. Still connected. Is that right?
Correct, Dr. Bu. On this one, connected pa rin tayo with the utility. So, yeah. And and the solar panels is connected to the load directly po ni hospital or ni client.
So if there's no energy from the solar panel, the Meralco, for example, takes over automatically, right?
Correct, automatically.
So
for one of our clients in Cotabato,
you can also opt to purchase a battery.
Correct. So for one of our clients in Cotabato, where power outages is actually prevalent, we're installing a hybrid system wherein we install solar panels and battery storage for their night load or even their critical load to their facility. So when there's power outages, our solar panels can still work. For this one,
do you have a solar panel that follows the sun?
No, for this one, we just rely on the sun to power our system.
But I have seen a system which the solar panels can follow the direction of the sun. They rotate.
So for that one, this is access tracking, but usually that's for utility scale system. So where you follow the sun throughout the day. So for our solution, we just have a fixed tilt. So meaning we just have the same orientation throughout the day. And we just ensure that there's no shading or we minimize the shading for the solar panels throughout the day.
Okay.
Most of the questions are answered already.
All right. So I think the most of the questions are answered
All right,
already.
so I guess that's it.
All right. So I guess that's it.
Some parting words before we
So
end our Q&A.
probably I'll give our speakers
We start with
some parting words before we end our
chronologically as they are
Q&A.
presented. So what's the first one?
We start
solar
with
panel, right?
the
Yes,
chronologically
go ahead,
as they
sir.
have presented. So what's the first one?
Thank you so much for
The
giving
solar
us the
panel,
opportunity
right?
to present our solution. Yes.
Yes, go ahead, sir.
So thank you so much for giving us the opportunity to present our solution to the whole Philippine Hospital Association. If you have any questions about our solution, feel free to visit our virtual booth
Thank you
and
very
we'll be
much
happy to
for
answer your
watching
questions. Thank you so much.
yes,
Okay.
our presentation
Dr.
also,
Choco,
and we
go
are
ahead.
willing to share the slides. As we
Thank you
see
very
in the
much
chat
for
box.
watching
There are a lot
or yes, our presentation also, and we are willing to share the slides as we see in the chat box. There are a lot of
and of course, we are willing
participants who wanted to have a share of the slides that we presented a while ago. And of course, we are willing to share it to you. Thank you.
Thank you po
Yes,
sa
Madam
mga
Abigail.
marami pa rin walang kasasawang tanong sa PhilHealth, no? But
Okay.
anyway, please, we have
Thank you
shared,
po sa mga marami pa rin
another
walang kasasawang tanong sa PhilHealth, no?
in terms of
But
how
anyway, at
we
least we have shared
So 30%
another
yet
breakthrough
help
in
to
terms of
Filipino people.
how
And
we
I
pay
just
our
want to
providers. So 30%
emphasize
is
na
yet
the
of help to
hospitals
Filipino
that
people.
through the
And
leadership
I
of
just
Philippine
want to
Hospital
emphasize
Association, we would
na
like to emphasize
the
that
hospitals,
you are
through
real
the leadership
partners
of
in
Philippine
health, and we
Hospital
just want to
Association,
request
we would like to
our
emphasize that
hospitals na in
you
submitting
are
claims,
our
we have
real
to make sure
partners in
na
health,
all
and we
details
would
are
just want
complete.
to request
And
our
also we
hospitals na in
emphasize that
submitting claims,
since we are
we have to
geared
make
towards
sure na
implementing
all
the
details are
DRG,
complete.
base
And
provider payment
also we
mechanism,
emphasize
we
that
appreciate with
since we
all
are
the
geared
IC
towards
codes and the
implementing the
RVS codes
DRG
are
based
listed
provider
po,
payment
no, dun sa
mechanism,
ating
we really
claim
appreciate if
forms.
all the
Also,
ICD
I
codes
would
and the
like to take
RVS
this
codes are
opportunity to thank the
listed po, no,
hospitals
dun sa
who
ating mga claim
participated
forms.
in our
Also,
costing
I
survey.
would
So
like to
that's
take this
on the national
opportunity
scale,
to
meron
thank the
po at
hospitals
least mga
who
hospitals sa
participated
lahat
in
ng
our costing
areas
survey. So
Pilipinas,
that's on
yung
the national
areas
scale, meron
Luzon,
pong
Visayas,
at
and
least mga
Mindanao. So we
hospitals
really
sa lahat
appreciate
ng
your
areas sa
support in doing
Pilipinas,
the
yung
costing
areas
survey.
Luzon, Visayas,
This
and
will
Mindanao.
be
So we
of
really
reference
appreciate
on how we
your
rationalize the
support
case
in
rate.
doing the
So
costing
marami pa pong
survey,
lalabas
and
na
this will
enhanced
be
case
of
rates ngayong
reference on
taon.
how we
Asahan niyo po
rationalize
yan.
the case rate. So
Sinilapalan po
marami
ito
pa
at
pong
sinimulan na
lalabas na
30%. So mas
enhanced
malaki pa
case
po kung
rates ngayong
30%
taon. Asahan nyo
yung
po yan
lalabas na
at simula pa
enhancement sa
lang po ito
conditions
at sinimula ng
this
30%. So
2024
mas
and the
malaki pa
past
po sa
years.
30%
With that,
yung lalabas
ganda
na
po
enhancement
po
sa
aming imbitahan
conditions
para ma-share po
this
namin yung sa
2024 and in the coming years. So with that,
from PhilHealth.
sana
Thank
po
you,
patuloy niyo po
Dr.
kaming
Bucastro
imbitahan
and the
para
rest
ma-share
of
po
the
namin yung
team.
mga bagong
Thank you, Madam Abigail.
news
Dr.
from
Mary D.
PhilHealth.
Happy.
Thank you, Dr. Bucastro and the rest
Yes,
of PHA.
in behalf of Carl
Thank you, Madam
Medical
Abigail.
Group,
Dr. Mary D.
sponsor
Happy.
of this event, we have learned a
Yes,
lot from our
in behalf of
partner
Carl
presenters as
Medical
well,
Group,
and we will be
sponsor
collaborating
of this
with
event,
each one of them as
we
well.
have learned a lot from our
Our
partner
three
presenters as well,
challenges today
and we
to
will be
our
collaborating with each
hospital
one of them as well.
associates in the Philippines is to
Our
visit our
three challenges today
company. We are
to
located at
our
third floor National
hospital
Bookstore
associates
building.
and affiliates is
You
to
will see our
visit
Philippine
our
Medical Depot, which is the
company. We are
vast
located at the third
showroom
floor
of medical
National
equipment.
Bookstore building.
Our next
You
challenge
will
is
see
you
our
can
Philippine
email
Medical
us.
Depot,
We
which is
have
the
provided in the chat
a
box
vast
the email
showroom of
for all
medical
who
equipments.
please. Medyo
And our
masyadong
next challenge is
maraming
you can
presenter
email
with
us.
business units.
We have
We are happy
provided
to
in the
share
chat box the
everything to you
emails for all the
through email
inquiries.
and
Medyo
contact
masyadong
numbers.
marami yung
And if you
na-present
would
namin
like to
business units.
avail
We are
the
happy to
first
share everything to
Philippine
you
Artificial
through
Intelligence
email and
pilot
contact
study
numbers.
for these
And if you would
hospitals, we
like
are
to
really
avail
encouraging you
the first Philippine
hospitals
Artificial
to take
Intelligence
part of this
pilot
pilot
study
study
for
because we
these
believe that
hospitals, we are really
our
encouraging
clinical
you po,
progression
mga
towards
hospitals, to
artificial
take part of
intelligence
this
will be
pilot study
helpful
because we
on our
believe that
clinical health settings in the
our clinical
Philippines.
progression
So we
towards
thank you for this opportunity
artificial
that we can
intelligence
invite
will be
you to be
helpful
part of that
on our clinical
clinical
health
study.
settings in the Philippines.
And this is
So we
Sir
thank you
Glenn.
for this opportunity that we
Yes,
can
Glenn,
invite
go ahead.
you to be part of that clinical study.
Attorney Doc.
And this is
On
Sir
behalf
Glenn
of
po.
Carl Group
Yes,
Companies, again,
Glenn,
thank
go
you
ahead.
very much.
Thank
Carl
you,
Group is willing to
Attorney
provide
Doc.
study as mentioned by
On behalf
Dr.
of Carl
Happy
Group
about
Companies, again,
AI
thank you very
technologies
much.
and the rest that we can
So Carl Group is
share.
willing to do pilot
We're
study
glad to
as
assist
mentioned
you.
by Dr.
Let's work
Happy
together for the
about
benefit
AI
of
technologies
patient
with
care.
interested
Understand?
healthcare institutions.
Is that big word?
We will be glad to assist you.
Dr. Dichoco,
Let's work
I
together
hope
for
it's
the
not too
benefit
late, no?
of patient
To
community. Maraming
ask a
salamat po.
question.
To God
Do
be
you have
the
some
glory.
kind of an AI in
Dr.
your
Dichoco,
IPP,
I hope it's not too late,
IPPC?
no? To ask the question.
Not
Do you
yet?
have some kind of an AI in your
No, we don't have.
IPPC?
Okay. I
Not
have
yet.
seen also from the presentation of the current.
No, we don't have.
An
Okay.
AI
I have not seen also
infection
from
control.
the presentation of the Carl Group.
Di ba? Wala.
AI on
Sir, we have
infection
a
control.
presentation and we would be happy to
Di ba?
share
Wala, no?
our
Wala akong nakita.
presentation to everyone.
Sir, we have a
Put
presentation and we
just
would be
include
happy
the
to
emails
share
where we can
our
send our
presentation to
presentation.
everyone
We
po.
could also provide a separate
Just
webinar
put your just
talk
include
about
po the
more in
the
details the
emails where we can
AI
send our presentation. We
studies
could also
and
provide a
different
separate
healthcares that
webinar
we have in the pipeline
to
as
talk
well.
about more in details the AI
Thank you very much to
studies
our
and to
esteemed
different healthcares
speakers
that we have in the
by
pipeline as well
providing
po.
all the insights
All right. So
for
thank
our
you very
learning
much to
this
our
afternoon.
esteemed
Thank you very
speakers
much.
by providing all the
Now we go to
insights
the awarding
for our
certificates
learning
for
this
our
afternoon.
speakers.
Thank you very
So
much.
first, the certificate
Now we go
of
to the
appreciation
awarding
to
certificates
Dr. Montserrat
for our speakers.
Tichoco,
So first,
Medical
the
Center
certificate
Chief,
of appreciation
Memorial
to
General
Dr. Montserrat
Hospital. In grateful
Tichoco,
acknowledgement
Medical
and
Center
sincere
Chief,
appreciation
Giuseppe
for
Lingat
having
Memorial
consulted
General
to share
Hospital.
her
In
professional
grateful
integrity as a
acknowledgement
speaker
and sincere
during the
appreciation
virtual
for
webinar
having
series
unselfishly shared
2024
her
Part 1
professional
with the
ingenuity as
theme
guest speaker
Healthcare
during the
Delivery,
virtual
Facing the
webinar
Risk and
series
Raising the Reward,
2024 Part
and whose
1 with the
contribution
theme
further
Healthcare
strengthened
Delivery,
the enthusiasm
Facing the
and
Risk
of the
and Embracing the Rewards,
given this
and whose
9th day,
contribution
March
further
2024
strengthened
via
the
online
enthusiasm
conference.
of the participants.
Dr.
Given this
Maria
9th day,
Lourdes
March
Teotaiza,
2024,
Vice President
via online
for Government
conference.
Affairs
Signed,
and
Dr.
Chairperson of the
Maria
PHA
Lourdes
Regional
Teotaiza,
Conference
Vice President
2024, and
for
Dr.
Government
Jose
Affairs
Santiago,
and Chairperson of the
President
PHA
PHA.
Regional Conference
Thank you, Dr.
2024, and Dr. Josepi Santiago, President of
And
PHA.
the next is,
Thank you, Dr. Tichoco.
the next certificate is
And the next
given
is,
to, next certificate please.
the next certificate is given to, next certificate please.
Next certificate please.
Next certificate please.
The control of the certificate presentation.
Who has the control of
We're
the
showing for Miss Abigail Estrada.
certificates
Oh, thank you.
presentation?
Oh, this one.
We're showing for Miss Abigail Estrada.
Madam Abigail
Oh,
Estrada,
link yung sa akin diba?
Chief
Oh, this one.
Social Insurance Specialist.
All right.
Benefits Development
To
and Research
Madam
Department,
Abigail Estrada,
Philippine Health Insurance
Chief Social
Corporation,
Insurance Specialist, Benefits Development and Research
same
Department,
content, the certificate
Philippine
and
Health
same
Insurance
signatory.
Corporation,
Thank you,
same
Madam Abigail. Thank you very much.
same content of the certificate and same
And
signatories.
certificate of
Thank you, Madam
appreciation
Abigail. Thank you
also
very
to
much.
Energy Light
Thank you po.
Ventures Incorporation.
And the certificate of appreciation
Same
also
citation,
to
same
Energy Light
signatories. Thank you
Philippines
very much.
Ventures Incorporation.
Thank you.
Same citation and the same signatories. Thank you very much.
And then we have the Carl Group.
Thank you.
Si
Holdings
Sir, ano to, no? Si Sir John
Same citation
Bernil.
and
And then we
same
have
signatories.
the Carl
Thank you
Group
very much.
Holdings
Dr.
Corporation. Same
Maridi
citation
Happy
and same
Sir
signatories.
Glenn.
Thank you very much. Dr. Maridi Happy and Sir Glenn. Thank you very much.
Turning you over to the host.
Thank you very much once again to all our speakers and to our moderator, Attorney Dr.
Turning you
Castro.
over to the host.
Reminding you again to answer
Thank
the
you very much once again to all our speakers and to our moderator, Attorney Dr. Bu Castro. Reminding you again to answer the evaluation form. The link was sent to the chat box and will be sent again and again, or you can scan the QR code on screen. Again, refer to the chat box, and to close this session, may we call on the Vice President for Government Hospital Affairs of the PHA, Dr. Maria Lourdes Otaiza.
Nobody's perfect.
Good afternoon. As we conclude this enlightening virtual webinar, I want to express my heartfelt gratitude to each one of you. Our collective commitment to advancing healthcare excellence has been truly inspiring. Dr. Montserrat Chicho's insights on institutionalizing IPC practices underscore the critical role we play in patient safety. Let's implement these best practices within our hospitals. On the other hand, Ms. Abigail Estrada's expertise shed light on navigating the complexities of case rate adjustments, and as healthcare providers, we must stay informed and advocate for fair reimbursement, which is really what the PHA has been doing all along. And that was an interesting presentation from Mr. John Michael Burnmill on solar panels and the environmental and financial benefits of investing in one. So let's explore sustainable solutions for our healthcare facilities, not just for solar energy. The speakers from Carl Group Holdings Corporation, meanwhile, have shown us how their different companies can be of help to other facilities by way of collaboration. Thank you to your partnership today, Energy Light Ventures Philippines Incorporated and the Carl Group Holdings Corporation, in bringing this virtual webinar to the members. We look forward to continued partnership in the next virtual webinars and in-person events of the PHA. As mentioned by President Dr. Joe Santiago earlier, we are celebrating PHA's 75th founding anniversary on September 15. Stay tuned for the following: Brillo, a captivating coffee table book chronicling our legacy. Mr. and Miss PHA, honoring outstanding individuals who embody our spirit. The Hospital Awards and the Hospital Best Practices in Infection Prevention and Control Awards Year 11, recognizing excellence. Remember, we are more than an association. We are a community dedicated to healing, compassion, and progress. Together, let's continue to make a positive impact on healthcare. Happy International Women's Month to my fellow women of substance. Enjoy the rest of your weekend.
Thank you very much to Dr. Otaiza for closing this session. Once again, this webinar series is brought to you by the Philippine Hospital Association in collaboration with Alta Renewables, Energy Light, and the Carl Group Holdings Corporation. So hope to see you in the second installment of the Philippine Hospital Association's 4-part virtual for 2024. Thank you very much for attending and enjoy the rest of the weekend.
Amin dong aku betul. Anak. Hah? Oh ini jauh tak? Baru. Daan tu, tidak kok.